Good morning, everyone.
Morning.
Welcome to the committee of the whole meeting this morning. Got quite a few here in the boardroom and out there virtual. We appreciate that. We will have a public, at the end of the meeting, we will have public comment where you can address the board at that time if you want to on anything that's on your mind. And we have some presenters this morning to talk about, and we'll do, I'll call the meeting to order. We'll have a roll call by Deputy Clerk.
Commissioner Barrios? Here. Commissioner Bardwell?
Here.
Commissioner Vaughn?
Here.
Commissioner Lutz?
Here.
Commissioner Cook is absent. We have a quorum. You may proceed.
Thank you. Anything to add to new business before we get going?
Well, Chairman, we were just talking at the end here about the Max 7th meeting, so we can take that near the end.
Old business, new business?
Put it under old business.
Old business at the end. Max 7.
Max 7.
Let's get started with new business. The Advanced Correctional Healthcare Proposal for Inmate Medical. Nick Burleson.
Morning.
Good morning.
Morning.
My name is Nick Burleson. I'm a program consultant with Advanced Correctional Healthcare. We have the privilege of serving this county for the past several years. This morning, I'm not here to resell you anything, something you already have. I'm here because after 24 years in this industry, operating in 17 states and 237 facilities, there are things I've seen go wrong for counties that never had to go wrong. And I'd like to share a few of those before you guys have a vote today. Think of this as what I'd tell a friend on this board before they signed any kind of correctional healthcare contract, even one of ours. Advanced Correctional Healthcare was founded in 2002 by Dr. Norman Johnson, a general practitioner who drove jail to jail in his pickup truck across Illinois because he believed inmates deserved real medical care. The Johnson family still owns and operates this company to this day. We carry no private equity investment, no organizational debt. We answer to the people in your facility and the agencies we serve, not to a board of investors wanting a quarterly earnings report. We care for over 15,667 inmates every single day across this country, and that's all we do. With that context, I want to share three things that I think every board should verify before voting on any correctional healthcare contract. Not because of who else is here today, but because this environment carries liability that most people outside our industry don't fully see until it's too late. First thing worth verifying is which professional standards any provider commits to operate under. Whether those standards are actually the ones in your jail will be measured against. There are excellent standards out there, American Medical Association, American Osteopathic Association. Those are gold standards for hospitals and clinics. They were written for those environments specifically. The standards that govern your jail, the ones that determine whether you pass in Michigan Department of Corrections inspection, whether you maintain a certification, whether you're in compliance the day a lawsuit is filed, are the NCCHC standards, or the National Commission on Correctional Healthcare, and MDOC's own standards for jails and small lockups. We operate exclusively under the NCCHC and MDOC standards. Those are the standards by which your facility will be judged on inspection day and in the courtroom. The question worth asking any provider is simple: which standards does your contract commit to, and are those standards MDOC will use when they actually walk through your door and inspect the jail? If those answers don't match, the gap's worth understanding before any contract is signed. The second thing I'd look closely at is how cost escalation is handled, specifically CPI adjustments. The CPI, the Consumer Price Index, is how most correctional health contracts are adjusted for inflation year over year. The important details are which CPI index is specified and if there's a hard cap on any kind of annual increases or not. Our contract specifies the exact index, the contract that's in front of you guys today. It's a 12-month rolling average for CPI for medical services, and the cap annually, the annual escalation for that cap is 7%. That cap's there for a reason. In the last decade, medical CPI has exceeded that 7% more than once. Without a defined index and a hard ceiling, a CPI clause is an open-ended financial commitment for the county. Ask any provider which specific CPI index governs your escalation and which is a hard annual cap. The answer is vague, then the risk sits with the county. And then finally, this is the most important topic on today's agenda, and it's one that I encourage the board to look at very carefully. When reviewing any correctional healthcare contract, you'll typically see two types of insurance listed: medical malpractice and commercial general liability, or CGL. Both are standard and both are very necessary. However, the third type, civil liability insurance, is one that specifically covers federal rights claims, and it's the ones that matter the most inside a jail. And here's why. Michigan caps medical malpractice damages at $598,000 for standard claims, and then $1.65 million for catastrophic loss. Because those caps, plaintiffs' attorneys in the state don't lead with malpractice claims against jails. They file federal civil rights claims. Deprivation of care under Section 42, United States Code, Section 1983, also known as the 1983 lawsuit. That's where Michigan's caps have no authority whatsoever. The controlling legal precedent is Estelle versus Gamble, a U.S. Supreme Court case establishing that deliberate indifference to serious medical need is a constitutional violation. That standard covers every healthcare decision made in your jail every single day. And then, more importantly, 10 days ago, April 2nd, 2026, a Michigan federal jury awarded $307.6 million to a former Michigan Department of Corrections inmate. It wasn't for a death, it was for a denial of a colostomy reversal. The jury found that that was a deprivation of his constitutional rights, and that was a federal court in the state of Michigan, and no damage cap applied. That verdict tells every plaintiff's attorney in this state that the standard of care denials are now actionable as federal civil rights claims, and that Michigan juries will award accordingly. The reason this matters for insurance is straightforward. A malpractice policy covers negligence in a clinical setting. It was not written for constitutional claims filed in federal court. Those require civil liability coverage, and that coverage must explicitly name the county and the sheriff as additional insureds. We have maintained continuous, uninterrupted civil liability insurance for over 24 years. We can produce our declarations page, our carrier's AM Best rating, and confirmation that the county is named as an additional insured today, if you'd like, if the board requests it. The question worth asking any provider: can you produce your declarations page confirming civil liabilities coverage, and does it explicitly cover 1983 civil rights claims in a correctional setting? If that document isn't readily available, that's not a criticism of any organization. It's a simple gap the board should understand before a vote's taken, because without that coverage, any exposure doesn't stay with the contractor. It comes back to the county and the sheriff and the individuals named in any federal lawsuit personally. I started this morning by saying I wanted to share what I tell a friend on this board before signing any correctional healthcare contract. Those three things: the right standards, some defined financial terms, and the right insurance. And they aren't unique to us. They're what any county deserves from any provider they trust with this responsibility. What I can tell you is that Advanced Correctional Healthcare was built to meet every single one of those. We've done it in 237 facilities across 17 states for 24 years, starting with one doctor in a pickup truck and still run by the same family today. In all that time, this county has never faced a federal civil rights judgment on our watch, and that's what we're here to protect. Whatever the board decides today, we ask one thing: just hold every option at the table to the same standard. The exposure is real, it's current, and it belongs to this county if the right coverage isn't in place. I appreciate your time. Thank you very much, and I'm open for any questions you guys have.
Any questions?
I have some. You're gonna have a doctor there? Was there gonna be a doctor there at all?
Yes, sir.
How long?
Our proposal, the doctor will be there, a prescriber will be there 1 hour per week, and then we have a 24/7 hour on-call option as well.
So you're gonna have a doctor there 1 hour a week?
Correct. For your population, that's roughly what we normally recommend for a population that size.
So if I read here right, the total medical is $273,521.42,
Correct, sir.
plus the mental health?
Correct.
22,000?
That is correct, sir.
So what would be the total of our responsibility there?
The total is $295,714.
I I'm sorry, can you give me that again?
Sure, it's right above, it's on the line right above. It's $295,000, 714.
So it's up from last year.
Correct, sir, by about $4,000.
I have a question. You talked about if requested, mentioned in this thing, so that's not included. We have to request that we have that additional.
Normally, that's provided with our contracts. I can provide it for you guys if you would want individually after this meeting, if you like.
Okay, but it's normally, because I'm confused.
I'm sorry.
Is it included or do we have to request that it?
It's included. If you
Okay,
would
but
like
we-
to see the proof,
Copy?
yep, we can
You'll
get you a
get that.
copy.
Okay.
Absolutely.
Now, if somebody needs a colostomy or they need some serious medical, you have a doctor here for an hour. Where, do you have a provision with an affiliated hospital service here? or
We
what
use
do
the
you do?
hospital in town.
You use the hospital in
Correct.
town? Okay.
So on that mental health at 22,000, is there gonna be somebody coming in there all the time?
So with that, we currently have a qualified mental health professional that comes in 5 hours a week to your facility. We would up that by 1 hour. So that's one of the amount of increase is dedicated to that, having that individual come in an extra hour. And I believe that is to cover the MAP program, to have an extra hour of group talk for the individuals that are involved with the MAP program.
So that extra hour is gonna cost us $4,000.
Correct. There's also a CPI increase from year over year as well. And I believe that was 4%. We might have actually reduced that even more to offset the cost for you guys.
Any more questions?
Chairman, I have a couple of questions. Sure. I'd like to direct them to Sheriff. I think he's behind. Yeah, there he is. You want to come up front or? I'm just having you come up front so everyone can hear you and I know you're not mic'd. So the question I have is, both of you, over the last year, what's the incarceration census been on the average?
Over the last year, our average daily population has been around 50, 60 inmates. The last month, we've been up to around 70.
And
75.
the capacity is 90, what was it?
92 is our.
92, you know, obviously not sending anybody out. So 70 or somewhere between 60 and 70 then, and that's been that way for the last year?
Yeah, yep.
Okay. And is this organization that you have now providing medical care has been doing it for?
I believe, so it'll be 3 years. If we renew the contract, it'll be May 1st, it'll be 3 years that they've been with us.
And with that, within that 3 years, has there been any concern about the serviceability, whether it be physician, nurse, mental health, or otherwise?
No concerns, no.
No complaints or actions related to prisoners filing, related to medical care?
Correct. I mean, inmates are always complaining about everything, but as far as anything that's tangible or anything, no complaints.
Nothing that you've seen that might be actionable that would be the magnitude that was just described earlier with the ostomy refusal?
Correct, nothing that would be actionable.
Okay. I was just curious because in the sense that the service we're providing, the number of inmates that we have, and if it's a rolling 60 or 70, which have an average tenure of how long in your facility? 10-year meaning how long is their stay?
It depends. I mean, some stays are, I guess it all depends what they want to do with the court. I mean, we've had guys, 90 days. We've had guys that have been there for a year and a half waiting trial. So I would say our average length of stay is probably 180 days if they don't run out right away.
And those that are tethered by the courts, are they involved in medical care whatsoever?
I'm sorry,
Those that are tethered by the court,
Yeah,
they're under the same plan?
they're all, everybody's under the same, whether they're pre-sentence or if they're sentenced.
So with that, with 60 or 70 inmates that are incarcerated, how many does that include these that are tethered, or is that? the
What do you mean
tethered?
by tethered, I guess?
They got it
Like
outside the jail, what do you call that?
Like out, not in the.
Like a
we don't
work
have
release?
tethers in the
Oh,
jail.
I'm sorry.
So,
You're talking people that are tied down to the court, but not actually within our facility.
Right.
They're on their
they're
own.
on their own.
Okay,
Yeah,
they're
they're
on
on
their own.
their
That's what I was attempting to convey. That seemed to be a bit odd at that point. I just wondered if they were included in any way.
No.
And what has gone on over the last several years related to inmate paying for their own care? We used to have,
As soon as they come in, Medicaid stops, so that we pay for everything.
so that the old efforts of trying to get something, if they have Blue Cross or something, or,
If they have insurance and we bill their insurance, I mean, and inmates get billed if they go out to the hospital, but chances of recouping that are slim.
there's, okay, well, I appreciate your thoughts and your comments. It's been some time since we've talked about incarceration. In the old days, it was always the fact that we were overcrowded and sending them out, and now since there's sentencing has been lightened, I was a bit surprised you had 60 to 70 inmates at a time with 180-day typical duration. Okay, no further questions, Chairman.
Chair, I have one. So are they doing any kind of mental health in the jail right now?
Yes, we get 5 hours a week for mental health in the jail, and then that's the qualified mental health professional comes in, and then if someone else, our doctor, when he comes in for an hour, can also see people for mental health.
One last question, Chairman.
Yeah.
So, gentlemen, of all the care that you've had in 3 years with the inmates, is there any area that you would like to see expanded or contracted?
The more mental health coverage, the better, in my opinion. I mean, it's population, our jail is rising in mental health, it's a crisis, but the more mental health coverage we can get, that would, what I'd like to see expanded.
We've
Uh-huh.
also been trying to, work on that MAP program too. Just to provide the care that people need while they're in there. That reduces some liability for us as well.
And with, in conjunction with behavioral health, I doubt if you don't get any assistance from regional center. do you? From behavioral health, that's been a conversation for many years. Almost said controversy. That too.
It is that too.
So how is that compared to a year ago, or how do you see that going? Because I sit on that board and it just seems odd. We've all had this discussion. It just seems odd that there's less involvement.
Yeah, we asked TBHS if they'd come up with some numbers to get them into the jail more. And I don't think we've ever seen any proposal come back our way. Lieutenant, myself, and the judge sat with TBHS, and to my knowledge, we're still waiting. I've never seen an email with any sort of proposal to bring them in for more. So I don't know if they're just not interested, or if this really takes a year and a half to get those numbers. I don't know what's taking so long.
I don't have the answer to that, but I know what the answer was at one time. It's the staffing issue, like everyone else, trying to find the staff
Right. That makes-
to have extra, I guess you'd call it extra availability to do that. I mean, I'll double check that at the next meeting, but in a sense, I was just curious how that was coming along.
They have, TBHS has, if someone is on treatment with them when they come to jail, they continue their treatment right now.
Yeah.
By treatment, I mean, they'll give us their medication, they don't do any counseling or anything like that, they just, we get their medication.
Pass the meds.
Yes.
Is the nurse that you have, is she a practitioner or what is she?
She's an RN.
Just, not just an RN, an RN. It's a very prestigious job. Okay, no further questions, Sharon.
There was a group that came before us here not too awful long ago, maybe a couple of months ago, that talked about mental health program from Wayne State.
The AOT,
Yeah. Have they implemented that, or has anything happened on that?
they haven't set anything up yet, correct? I mean,
Well, we
they
did-
did the jail tour.
Right, yeah,
But that's
we've had a
fine.
jail tour, they took notes, and then they're supposed to get back with us about other stuff, but we're still waiting to hear back from us.
Okay, guys, thanks. Any more questions again for Nick? Appreciate it.
I appreciate your time, Jim.
Thanks.
Folks, thank you very much.
Aspire quote for inmate medical services. Andrew Daniels.
After that, I feel like I need to say, may it please the court. My name is Andy Daniels, and I am the co-CEO of Aspire Health System. And let me just take a minute to talk to you of how we got here even on this proposal. The proposal really came out of medication-assisted therapy. That's where it started. So what has happened routinely over the course of time, we get the call because the current prescriber won't do MAT in the jail. So what happens is one of our doctors gets the phone call and says, hey, can you prescribe MAT for this physician or this patient or this inmate that's here? Our doctor won't do it. And so it kind of put us in a little bit of a strange situation where we have a doctor outside of here that really doesn't have that tight of a relationship that's being asked to do something on behalf of an inmate that is in the jail. Now, we've been doing it because we believe in the program, but it is weird and it has to be somewhat resolved. So it came about as in, what is it that you really need or you don't need? And the theory behind it was we needed better linkages for medication-assisted therapy and all the things that go along with it. So this is where the proposal started, and we backed into the rest of this proposal. In our current proposal, we attempted to match what you have with a slightly different twist. So our qualified mental health providers are also APPs, they're prescribers at the same time, so that while they're in the jail 5 hours a week, they also can do the medical prescription. They also have an overseeing doctor that is willing to do all the MAT therapy, and so that is where part of this came from. That's where mostly it came from. We also added in the ability to take sick patients to our urgent care. So that is included up to a certain amount per year. I think the cap is, actually, you can take them anytime you want for a visit, but if they need x-rays or labs, that is included up to $25,000 a year. We thought that would be more convenient for the jail if they had someone who was truly sick or needed an urgent care situation, take them over and cover that, so there'd be no charge to that to the county unless there's some sort of an excess above $25,000 per year for x-rays and labs. Probably won't happen, but could happen. We also added in the ability to get prescriptions through our pharmacy. So again, not a huge additional expense to the county, but with MAT there could be. So basically we're going to use our pharmacy, deliver that over at cost plus a $10 fill fee. And that was basically how we structured that. So all in all, what we're really trying to do is just help. We're trying to help the situation. If you so don't select us, we're not going to get mad and take our ball and go home. We are going to ask that somebody figure out a better relationship to cover MAT in the jail. If you're going to continue to use an Aspire doctor, there has to be some sort of relationship in which to do that, whether that's between you and us or between us and the current provider. It doesn't matter, but it's got to be formalized somewhere or the other. As far as the proposal, it is, generally speaking, I would say it's going to be less cost. We're a nonprofit, so we don't have to make a bunch of money. We just have to cover our costs with enough margin to cover the overhead. We propose the same thing, to put a nurse there 40 hours a week to match. We'll have the qualified mental health provider that also is a prescriber 5 hours a week. And then also, really anytime the nurse needs a prescription or anybody does, we have 24/7 coverage, so it's not that big of a deal. Plus the value adds of being able to take inmates to the urgent care when it's open at no cost to you, except unless there's labs and x-rays, and also get prescriptions from our pharmacy at cost plus a fill fee. That's basically the nutshell all the way around. We did put in the contract that we would get the civil unrest liability insurance that is in there. The CPI was limited to the regional CPI, not for healthcare, but generally the regional cost per living, and also the contract's only for a year, so it auto renews unless y'all don't want to. So if something goes crazy in CPI, we can always sit down and do that. You're not obligated beyond a year to continue the service. Just to address some of the items. As far as credentialing requirements, we have 1 million. We're the most highly regulated industry in America when it comes to the different standards we have to comply to between CAP for lab and radiology and DNV and CMS and you name it, and the state of Michigan, and we are really not have any fear in complying with another set of regulations. They are practically a subset of each one. And that's kind of the gist. I take any questions you have, but that's really where this started out of. It really started out of wanting help.
I have a question. So your total is 280,000, am I correct in saying that? Looks like
Yes.
here. You're gonna give 5 hours a week of mental health, and that's part of the 280.
Correct.
Plus it's, you're gonna have telehealth on yours also, right?
Yep. Just like the current contract has the telehealth.
I have a few questions.
Sure.
On the MAT, it sort of intrigued me in the sense that you were getting requests to write the docs scripts. What would be a typical, maybe atypical scenario that would occur where they wouldn't write a script?
So,
What would that be?
I mean, any doctor that is trained in it or is comfortable writing it can write it. It's just the current doctor that oversees the contract, my understanding, is not comfortable with doing it, and so they just won't. That's my understanding. So when they have someone that comes in that needs that assistance, because we have an MAT program within the county, they call us and say, hey, this person's in here, they're on Suboxone or whatever it is, a derivative of it. Can you write this script and help us out? Because they can't get the script through their normal process. So for example, an inmate might come in, let's say the inmate is, I don't know, they've got the flu, they need a prescription. Well, they'll go one way to get that prescription through the current doctor and the current service. But if that inmate is also on medication-assisted therapy, they call us to get the script for the medication-assisted therapy.
If that were eliminated, wouldn't that expedite the time it would take to get a medication to an inmate?
I don't know if that were,
Case by case?
yeah, I don't know. It's negligible probably either way.
Well, it seems that in the past, there's been concerns about medication being withheld, going back to.
Sure.
And that's what I was keying into. But it's interesting that in another service, there's a physician, I don't know.
A
whatever,
physician, yeah.
A physician that's reluctant to write a script, and that under this MAT program, that the loophole is, I'll push it out to somebody else. Well, I don't understand that. Why would a doc, other than his own personal recognizance, I don't want to do it? Why would that happen?
Well, it's really just that it could happen. The doctor may be older and is not trained in it. They may be not comfortable with it. It's something that's relatively newer within the last 10 years or so. I can't answer the question. The folks that we have that prescribe it, they've been through the training program and they know what the protocols are and they know how to do it. I can't answer that for you.
Would the prescribing pharmacy be located in Carroll?
It would be, no, we have 3 pharmacies currently, so it's either going to be Cass City, Marlette, or Deckerville, and we'll just deliver it over.
And you deliver. And then anyone who would need medical care would go to hospital of their choice, or is there?
Yeah, so just like today, if there's an emergency, they're going to take the patient to the closest emergency department. If it's not an emergency and it's more of a sick issue, then they can take them to the local urgent care here.
In summary, Andy, as you've been in this business a long time, from your perspective to the board, what would be, and maybe you've already outlined this, but just re-outline it again, the chief advantage is having this service locally versus expanded?
The chief advantage probably is in reality, they're probably somewhere in the system already anyway. So between the 3 hospitals and the 120,000 office visits we do between the 3 hospitals and our Epic EMR, the continuity of care is probably there. I can't confirm it exactly, but you have the same population that lives here that comes and goes. And so we have a little bit better understanding of their overall, I'm going to say we have a probably, more likely than not, a little better insight into a more comprehensive picture of the inmate and the patient, just because of our size and our connection of our electronic medical record throughout the region, right? We can see everything from somebody that's been to Saginaw all the way to Marlette, Cass City, Sure, Hills and Dales. They're all connected, so we all share the same electronic medical record, and so there's pretty good odds that somebody is going to be already in that system somewhere. That's part of it. The other is really we're trying to make strides with the MAT in the county. We started working with the other side of the house, which is Judge Gearhart and some of the committees that they have there. We're now sitting on, I think one of them is sobriety court and the other one is, I always forget the name. There's a sobriety court and one's a drug side, one's a alcohol side. We're now participating in that. And so it's really just, we were just really looking at it in terms of comprehensive connectivity of care. And that's really the best picture I can give you.
McKenzie and McLean, are they all on Epic or they just communicate with each other?
Mackenzie is not. So Mackenzie is the one in the that chose to go with Mid-Michigan. So their Epic does not connect to anybody else's Epic here for whatever strange reason.
But the majority are Epic in the
The
area,
majority are Epic, yeah.
including Covenant. Yeah, I know Covenant.
Yeah, all of our, I mean, all three of ours are hosted at Covenant. Both Sure Hospitals and Harbor Beach are hosted at Covenant, so they're all connected in the system, which is what the EMR we would use in the jail. So we would actually put the department in the jail and use it in the jail.
No further questions at this time, Chairman.
I'm good.
Okay, thanks.
We appreciate it. Thank you.
Chairman, has legal had an opportunity to review either of these contracts?
They did. They have some comments on the Aspire contract, which Aspire agreed to the changes. So legal has reviewed both the contracts.
Okay, thank you.
So you want to look at both these contracts, come back on Thursday and make your decision then? Okay. Number 3, we'll move on to the Economic Development Corporation, EDC, request for authorization to apply for administration for a state streets and roads grant. Lisa Proctor.
Yeah, good morning, commissioners. I'm here with Bridget Antes, Taylor Manty, and then Daryl Pooling. He's going to present for us today. This is there's an opportunity for us to apply for the US DOT Safe Streets and Safe Roads Grant. And I'm here to get authorization and approval from the commissioners to apply and administer this grant on behalf of the county. And I will let Daryl give his presentation and then you can answer any questions after.
Okay.
That works for you?
That works for everybody?
Is he there?
Is he?
I have to unmute myself apparently. Can we all hear me?
Yeah. We can hear you.
Good. Okay. Commissioners, thank you for having us today. Sorry I couldn't be there in person. You have to deal with my loud voice over the loudspeaker here. So I'll take a few minutes to talk about the Safe Streets Roads for All program through the Federal Highway Administration and US DOT, and we'll navigate this remotely. So if you go to the next slide, please. I don't know who's got it. There we go. Okay, cool. So a little background on the Safe Streets Roads for All program before I get into the components of it. Know that it's a program administered by Federal Highways. It provides 80% federal match funding for development of a roadway safety action plan. which works through data analysis and public engagement to identify and design analysis of transportation networks, regardless of ownership, to find those areas that are considered the high injury network, which are very, the dangerous areas that cause the most injuries and fatalities, and to develop countermeasures or constructed or education programs to reduce those injuries and fatalities. The end result is a plan that you can take out onto the street, whether it be through Michigan DOT, US DOT, federal highways, whatever grant giving agency there is, to then find construction funding in the form of grants to get these construction countermeasures completed. So the plan provides a baseline and the required background information. In most cases, this is required for grant programs for construction funding to get out and actually make the roads safer. So through the plan, we're identifying things and engaging with the public and analyzing data, with the end result being to go out and find the money for construction funding. There are 7 components required by the Road-Based Safety Action Plan. They go through data analysis, goal setting, project identification, that kind of stuff. I'll roll through that pretty quickly because I think Alicia did a good job already prior of kind of giving a little background on what this is. So I don't want to rehash it more like an answer.
You're breaking up a little bit, Daryl.
Oh, geez. Let's see. Maybe I can change the microphone, and that'll help me not break up so much here. Let's see. Is that any better?
We can hear you fine now.
Good, good, good. All right. So if someone can go to the next slide, please. So through the Road-Based Safety Action Plan, through this grant, you can do any number of things. It's almost the only thing we can't really do is any kind of engineering or design aspects of any improvements. So we can do cost analyses and cost estimates, which are part and parcel to this program when we talk about priority projects. But we can do everything from land use planning all the way to building GIS databases for transportation networks. So looking at roadway widths. If we get into suburban areas like Caro, we look at parking spaces, pedestrian crossings, pedestrian infrastructure or lack thereof, sidewalks, curb cuts, all kinds of robust GIS data we can gather for you, and then the county can use then after this plan is over, because once we gather it and have it as part of the plan, it becomes owned by the county. So we develop this stuff and you can have it for any kind of projects you have in the future. Next slide, please. So looking at not just the design elements, not just gathering GIS data or land use analysis, if we go that route, but looking at the traffic crashes themselves. I'm a former policeman and traffic crash investigator before I became a planner and transportation planner. So I've got a unique kind of perspective on traffic crashes and their causes, and then the solutions to reducing the injury probability. So we take crash data in the entire county and look at crashes, not just what kind of crashes they are, but why they're happening, what's causing them. Are there roadway elements? Are there weather elements? Are there design elements? Are there behavioral elements? Are folks speeding along? Are there illegal passing on rural roads, for example? Are we running stop signs? Looking at all these things together to determine why crashes happen. In this case, in this community, we looked at car versus building crashes, which is just an interesting way of demonstrating the depth that we get into the data, looking at even, the day of the week crashes happen, the time of the day, the season, all these sort of different things to look at our traffic crashes to determine why they're happening. Next slide, please. So this is just some more of the ancillary information and data we can build through road-based safety action planning. We can help the county develop paving plans, work with the towns to develop paving plans, work with the city, because they're all within the county, to help them develop things, do sidewalk gap analyses or multimodal transportation gap analyses, pavement condition ratings. We could build a bridge database if the county needs assistance with building sort of a database and plan to help monitor and rate bridges, for example. So all these things fall under the Safe Streets and Roads for All program through the planning grant. Next slide, please. So one big primary portion of this plan is to develop the high injury network. So that's the smallest percentage of roads that account for the largest number of injuries and fatalities. The Road-Based Safety Action Plan and the Safe Streets and Roads for All grant is based on Vision Zero, which essentially says that fatalities and serious injuries are unacceptable on our roadway networks. And we have to do everything we can in terms of design, countermeasures, and education to create sort of an environment where crashes, when they do happen, would be property damage only, or no people would be injured. Understanding that we're human, we make mistakes, crashes are going to happen. We need to create them in an environment where there will be minimal or no injuries. So developing this high injury network and then pulling priority projects out of that. So looking at those areas that are specifically or particularly unsafe from a traffic safety standpoint, and understanding what's causing those crashes and suggesting tried and true countermeasures that are backed by data, backed by research, and then vetted to the public to reduce those injuries and fatalities, regardless of roadway authority, right? So they could be state roads, county roads, town roads, city roads. This plan can still make countermeasure suggestions and priority projects, regardless of ownership. So in the case of the state DOT, for example, what would happen is state of Michigan would come in and want to make changes to a roadway. They're going to look locally to see if there's any plans in place before they make their own suggestions and make their own determinations. So if there's a county road-based safety action plan in place that has countermeasures suggested that are data backed and data driven and publicly vetted, they're going to look to those first because they know those are locally acceptable rather than creating their own beforehand. So the other thing we do is look at a high risk network. So we take design elements, we take observations, we take public engagement and feedback, local knowledge, and say, okay, what are these areas that maybe crashes aren't happening as much, but the design elements and public feedback tell us that there is a high potential for injuries and fatalities. And we look at those areas and say, okay, what kind of countermeasures here can we suggest that can stop injuries and fatalities from happening in the future? So taking a proactive stance rather than reactive. Next slide, please. So, what we do is we have these really neat tools called MioVision cameras, which essentially are cameras we set up at intersections or corridors that look at traffic. So they're not gathering vehicle data, they're not gathering human data in terms of facial recognition. It's not anything like that. What it does is it tracks objects, determines the type of object they are, the speed and the trajectory. So it'll determine if it's a car, a bike, a scooter, a person. It'll look at the direction it's going and the speed it's going, and the trajectory that it's taking, determine if a crash has almost occurred, helping us to document what we would call near misses. Those things that obviously are not crashes and they're hard to quantify. But if we can quantify near misses, we can try to understand these intersections where maybe crashes don't happen as much and we're concerned they would, or maybe they do happen a lot. We're trying to figure out why they're happening. I have a video here I would usually show, but the link I don't think would work here. So I can share that with Alicia and she can give it to you all, but it just demonstrates the camera, the capabilities and what it shows you. It's just a super cut of a really bad intersection that shows the vehicle tracking and the near misses and all that kind of stuff. But know that this is an acceptable tool for most state DOTs for safety studies. And state DOTs actually love this kind of data because it projects out potential critical incidents and allows you to model potential danger and then be able to go out and find funding based on that alone. Next slide, please. This just talks more about what those MioVision cameras can do. Yes, they do near misses, but they'll do traffic counts in real time. They'll do turning movement counts. They'll look at modal share. So if you're in a suburban area, it'll tell you how many people on foot, on bicycle, and a motor vehicle. And it'll even give you in corridors a minimum maximum speed and average speed. So if you got spaces like cut through roads for in residential areas adjacent to commercial areas, and folks are shortcutting stoplights or traffic control devices or traffic, we can look at the average speed and determine if there's a speeding problem and try and work with the community or work through countermeasures to alleviate those speeding conditions to make sure those residential roads are safe. We're almost done, I promise. Next slide, please. So we do a lot of public engagement. It's kind of part and parcel to what we do, not just as planners, but it's required as part of the plan. My team loves this picture of me as a traffic cone at a trunk or treat event. I don't wear that on a daily basis. It's for a Halloween event. So we get to go out and do really cool stuff, right? It's not just data analysis and steering committee meetings and crushing crash data and looking at roadway design and GIS. It's going out and talking to people, it's great for two reasons. Number one, it lets us hear from people and understand how they use the transportation network and understand, the areas that they think are unsafe and that they avoid because of traffic safety issues. But it also shows folks that something is being done, right? Well, yes, we're the consultants. To the average person, we're still the county, right? We're working on behalf of the county. So they see us out there. They see, well, the county really cares. They're getting out here talking to people. They're trying to make a difference. They're doing good work. Like, this is really, really important to people. This is important to them. We were like seeing this. So it's really good from an engagement standpoint and from showing that something is actually being done. We're trying hard to alleviate traffic safety issues to make the road safer for everybody. So we look at typical open houses where we would have an event. It's from X hour to X hour. Folks would come in, engage, and leave. Online surveys are really good. Neighborhood design workshops. If we find areas in residential or commercial areas that have roadway safety issues, we can partner with those very intimate communities to understand the type of countermeasures that maybe they would like to see. And then finally, pop-up events. Looking at those events that are already happening, understanding that people aren't usually going to take time to come out and talk to us. Just us. If we can go to these events, whether they're county fairs or community, community events, community fairs, put up a table, put up an easel, a poster board, some stickers, and just start talking to people. That's a really great way to get a feedback on roadway safety. And then working with the school districts, doing art projects with the kids. District-wide art projects are really popular, where we give a prompt to the school district and say, art related to roadway safety, or art related to reducing speeding. And kids from kindergarten to seniors in high school develop any kind of artwork that we can then include in the plan. So it helps us to not only drive engagement at the local level with families that are really important, but also it kind of beautifies the plan. Next slide, please. And this is just some kind of examples of the artwork we've included in previous plans that the kids have done at all levels. And it dresses up what we're doing. But it also, like I said, it helps to drive that engagement and also hopefully helps teach kids a little bit more roadway safety. And the next slide, you'll see just it's a cut of different engagement events we've been at, whether it's trunk or treat, whether it's hanging out on a bike path and bothering people, whether it's an open house, whether it's talking to kids, all kinds of cool stuff we get to go out there and do to engage on behalf of the county to hear about roadway safety. Next slide. So we've talked about all this data analysis, GIS, planning, public engagement. It's all really good, right? This is all fantastic, but what is the outcome? Like, what are we actually doing here? So we look at this intersection here. It's probably one of the worst intersections I've ever seen. It's down here outside of Dayton. It's the confluence of four roads. One's a 4-lane divided highway, 55 miles an hour, 50 miles an hour. One's a rural 2-lane highway. One's a small 2-lane road. One's a 4-lane road that goes into Main Street, into downtown. Two creek crossings right adjacent to the intersection, and 2 railroad crossings right adjacent to the intersection on a live railroad spur. It's the world's worst intersection. So we look at this and say, okay, here's where the crashes are occurring. And we move to the right. What are the actual countermeasures that we can employ here that'll make this safer? In this case, there was no lighting. Adding lighting to help people see to reduce crashes. Something as simple as protected left turn phasing on a traffic signal to make sure that we're not getting those left turn crashes, which are one of the most dangerous movements you can do in traffic as you cut across traffic, especially at high speeds. Upgrading signals to make sure they can handle different types of phasing and timing, road crossing realignment, all these kinds of things to improve that run the gamut from really, really simple, like protected left turn phasing, all the way up to railroad crossing realignment, which is probably the hardest thing to do because the railroad companies are really, really hard to get to do things within their right of ways and do things at the intersection. So part of this plan is suggesting things that run the spectrum from cheap to expensive, from long-term to short-term. Next slide. So we don't just look at design, or don't just look at constructed elements. We take a design approach to this as well, looking at how we can change roadway cross sections so that when roads are repaved, when utilities are redone, we can actually change the built environment to make it not only more safe, but to make it more community oriented, to drive economic development, to drive community development, to help the community build wealth, right? Street trees, separated bike lanes and sidewalks if we're in an area that would support that or where that's feasible. Increasing the pedestrian space, curb bump outs, all these kinds of things to improve the suburban areas, the suburban corridors, to drive business engagements, drive economic development, to help build community wealth. So it's not just an engineering practice or a planning practice, it's a design practice as well. Next slide. So this is a great map of improvements across an entire city here outside of the Columbus area. This looks at the high injury network areas and shows in a really nice digestible way the suggested improvements to reduce fatalities and serious injuries. This is probably the most important thing, other than the table that I'll show you very quickly at the end because it's really painful, but it demonstrates what we do. And I think it's on the last slide that I don't want to go to just yet. But go to the next one. And I think it's got talk about funding, right? So again, a nice little map on the right here showing the high injury network in the areas that we see and the countermeasures we'd see that would be required. So this plan, it's all done, it's all pretty, we've done all this stuff. So now what's the end goal here? We don't want this plan just to sit around and collect dust and walk away. We want this to help you find funding for construction projects to actually make the road safer, whether it's MDOT, whether it's Safe Routes to School, whether it's whatever US DOT programs are reauthorized as part of the Surface Transportation Reauthorization in September. This plan will help you go out and find that grant funding, because what we're finding the last 5 years and probably into the future as grant funding tightens up a little bit more is that you need this background data. You need this plan sitting there to demonstrate you've done the work and you laid the groundwork for going out and finding construction funding. We're finding that US DOT and state DOTs do not want to give out grant funding for construction if the proper background information has not been gathered, if the proper traffic and transportation analysis has not been done. So this plan puts you ahead of the game. And in some cases, at the US DOT level, is a requirement to find construction grant funding. The Safe Streets program does end this year, but only in name. So what's going to happen is it's going to be reauthorized as something else come September. Just like this was authorized 5 years ago. Every 5 years, they have to reauthorize transportation funding. So this program will continue in some different kind of name. And this kind of planning is going to be essential to being able to go out and actually find construction funding. And when this is all done, we're going to go out and help the county find construction funding. Right? We're not just going to give this to you and walk away. It's our job as planners and as your consultant and as your partner to go out and then find you grant funding to get construction done to make the roadway safer. That's really, really important. And that's something we take a lot of pride in. And then just show the next slide real quick, because it's painful and horrible to look at, but as a demonstration, this one community wanted a priority list of projects and how they affected the roadways, looking at the crash reduction factors, the modification factors, the type of crash it would address, all these kinds of things that it hurts your eyes to see. But it's kind of the center point of the actual plan when you go out and find construction funding for these priority projects. A little bit of background about this roadway safety action plan, the Safe Streets for All, before I ask for any questions, is the application window's open. It ends May 26th. It's not first come, first serve. We just have to have it in by the 26th of May. Awards are announced around the end of the year. And then grant agreement process starts early spring, late winter of 27. And then work would start after the agreement is authorized with Federal Highways about this time next year. The 20% local match is reimbursement basis. It's not upfront or back end. So you're not writing a check in one chunk and moving. What's happening is you're sending FHWA a invoice or a proof of work every month, and they're reimbursing you at 80% every month. So not only is it not a check up front on the back end, but it can be spread across 3 budget years. This is about a 30-month program. They're suggesting we take 30 months to do this. It can be done a little quicker. You can probably do it in 24 with a county of this size. But the most important thing there is that the local match can be spread over multiple budget years, which helps soften the blow. Even though it's just 20%, it's not a large amount. We're not talking hundreds of thousands or millions of dollars, but it's still good to be able to spread that out to make sure that you're not over encumbering yourself in any way as it relates to transportation funding. So I have talked enough now. That's 20 minutes of my voice yapping away. What I want to do is open the floor to everyone else for questions.
Daryl, will you touch on the part of the steering committee and then also the pilot implementation, that the pilot part of it that is also available?
Yeah, I would love to. So the steering committee is one of the required components of the plan through federal highways in the agreement. What it is it can be kind of cobbled together any way the county would like to. There's some best practices in terms of having a commissioner on the board, or on the steering committee rather, having some representatives from local governments, having some like residents from around the county or business owners, like roughly 11 to 15 folks who get together on a bi-monthly basis. We show them the work we've been doing and they help us decide where to go next. That's really, really important. It helps to guide the plan. So it's not just the consultants doing whatever we want to. It's actually the local community and the county helping to literally steer the plan in a direction so that we're looking at the things that are not just important from a data standpoint, but are important from a local standpoint. As it relates to the demonstration portion, so there is, this funding can be used for what we call demonstration activities. So if there's particular intersections or corridors that you think are unsafe and you already have an idea of how you want to address it, or you'd like to try and address it temporarily to see if a potential countermeasure would work, we can do that as part of this funding. So a good example is, say you've got an intersection in a downtown area that is, the intersection is really wide, the roads are wide, the pedestrian crossings are really long. Maybe we want to demonstrate some curb bump outs in some kind of expanded pedestrian areas to see if that slows traffic down, makes the roadway safer. So we could do that as part of this grant program, where then we would put up some kind of like plastic bollards or something, or some temporary implements to narrow the roadway, narrow the intersection, and make the pedestrian area or the pedestrian crossing shorter to see if it has an impact on traffic safety. So we would use our Mio Vision cameras to look at speeds and turn and movement counts and modal share before we demonstrate something, and then we put up the demonstration materials, and then we use the cameras to monitor after to see if that has any kind of effect on traffic safety. So that's something, any kind of demonstration activities, whether it's roadway narrowing, whether it's maybe a mini traffic circle, whether it's medians, any of that kind of stuff we can do as part of demonstration activities if we feel like there's a particular part of the county that we want to try and do some activities in.
And I know before questions, this doesn't address like things that are happening right now, but it's something that we can implement for ongoing efforts, which is really important because this will be an ongoing issue. It's not just something that we're gonna stop seeing. So that's really why I wanted to bring it in front of you guys to get that planning piece put together for the county. And then I'll let you answer. Will I answer any questions?
Okay.
And Daryl will as well.
Chairman, I have a question. Go ahead. Talk about the studies. How long does it take to do the studies?
Federal Highway suggests about 30 months, which seems like a long time. We can reduce it to about 2 years, about 24 months. I wouldn't go any quicker than that, just because of the amount of data analysis and data gathering and community engagement that's required, as well as it having to be adopted by the county. That kind of narrows up the time frame. So 24 months is about where I would see a good timeline.
Daryl, if there are some already identified issues, can we get right into demonstration pretty quick?
Yeah, absolutely. So, and that's season dependent, right? Like if we start in the winter time, it'd be hard to do the observation beforehand. If it's snowing or something like that, you're not going to get good data. But you start this thing most likely in the summer of next year. We have areas that we think are good for demonstration. We can throw the cameras up right away, look at the intersection beforehand, get the demonstration materials right in there, and look at it immediately after. So we can move as quickly as the county would like to see us move, which is actually good for federal highways because they have to do some baseline NEPA or environmental protection stuff to make sure that we're not, having any effects on the environment. So they want to know ahead of time where our demonstration are occurring. So having it done ahead of time is really good.
Well, what we ran into before is the road commission says, if we're not doing the work, you're not getting it done.
So this is a steering committee, and I don't think it'll necessarily work like that. Correct, Daryl?
Correct. Yes, steering committee driven.
Yeah. And that's also why I brought it to your attention, with the changes going on, something that we can still move forward with, and keep things moving, to have safer roads and streets, for the county. I feel like that's important. We have a number of increased fatalities going on throughout the county. It's not just one particular area. We have identified at least 5, and I'm sure there's more. So I feel like this is a very important grant to go after, as well as this is the last grant of its kind. It doesn't mean that they won't make something similar, but this one is the last grant. I did sit down on Tuesday. They did say that they are looking for counties or areas that are having an increased number of fatalities. So,
And rural areas, right, Daryl?
yeah.
Yeah, that's correct. So there's 2 things that play really well to the county in terms of this grant application. Number one, it's your rural area is really important. This was developed primarily for your rural areas and your smaller communities, of which this fits into the rural category. In addition, I don't have the number right in front of me because I ran it last week, but in determining eligibility or determining awardability for this grant, Federal Highways looks at certain metrics. One of those is deaths per 100,000 residents as the metric for roadway safety. And anything above 17 deaths per 100,000 on a yearly basis is considered highly desirable for Federal Highways, and the county scores well over that. So bad in the sense that there's a lot of fatalities, but good in the sense that it gives you kind of additional chance of being awarded the grant. And I think in this instance, it's almost a sure thing to be awarded. I wouldn't be concerned, nor would I bring it to you if I didn't think the county would be awarded the grant.
So let's talk about exactly how this grant works.
So the EDC, like other grants, we would apply on the behalf of the county, kind of like the others. I would administer and work with Verdantes to run the grant. I would help, with the steering committee and the planning portion. And then I'm
The
sure.
grants for how much? Was there a,
How much are we asking there?
I thought it was 400 total, but there's an 80,000 local match. So the 400 is the overall grant. 320,000 is the federal share, 80,000 is the local share, spread over probably 3 budget years on a reimbursement basis.
And I did sit down Tuesday, and they did, I hate to mention it, be wrong, so I'll look into this, but they did talk about some in-kind type of match, but we can look into that further as well. I don't think it would cover the whole match, but something.
Yeah, the local just has to not be other federal dollars. It can come from anywhere else as long as you're not stacking federal money. That's all they care about.
and the county share is paid up front or not?
No.
No, so it's a reimbursement basis. So over a period of, but the life of the grant, whether it's called 30 months on a monthly basis. So you send in an invoice every month for the work done or the costs incurred. Federal Highway sends you a reimbursement for 80%.
So basically, the $400,000 is reimbursement.
80% of that.
80%.
80% of it, yeah.
So you get, as you're getting monthly bills from us or whoever does the work, because it's gotta go out to RFQ, right?
Correct, yes. I mean,
Right.
even if we help you do the grant, we help you do all this.
But,
Sorry, Taylor.
yeah,
And so we hold other grants like that, so it's not as sticky as you're thinking in your head. Most of our grants are reimbursable. And so similar ones is I will get invoice from the consultant, and then I submit it, and then we have quarterly reports, and so that's when the state usually sends that funding back in, and then we pay the invoices.
they're just forwarding the invoice each month to FHWA.
Same with, we hold the federal EPA grant as well. It's a reimbursable grant as well, so,
So we're not spending $200,000, let's sign an invoice for $200,000 for reimbursement. Is that,
Right, I wouldn't ask it for you up front. We would have the money and then we just pay, yeah. You have to show the reimbursement, so the consultant invoices you, and then you have your person on the federal side, or I don't know if they use Acres for this, but we submit the invoice through Acres, and then it gets reimbursed, and then I pay the consultant.
Chairman,
Yes.
I got a lot of questions. It's probably not appropriate for this meeting, but you've covered one in terms of the presentation. There's a lot of metropolitan areas, and what we're dealing with is rural application. The second major issue here is it's an $80,000 copay over a period of time, $400,000, $27,000 a year, so to speak. No matter what, the county has to put up the money to get reimbursed. You get billed, we pay it, you submit.
Well, no, so
How does that work?
So I submit it into a system, and then they send in the money, and then yes, we get reimbursed. You have that 20% or that 20%? 20% match. So that's,
So the match is all that the county is obligated to.
yes,
All right, so there's not any transfer, in other words,
no,
the 400,000, we front it, they reimburse it at all.
And that's what I was trying to
no.
27,000 a year. Ladies and gentlemen, I just want to remind you that we don't know what's going to happen financially in 26 yet. We don't know 27, and we're looking at an option that projects out, and it wouldn't even start for a year, to do something that, this is my discussion, maybe we should save it for the road commission discussion, that should be done anyway. So I'm not exactly sure how to balance, based on the financial constraints, how to weigh this out. And the mere fact that you do have a steering committee, does that steering committee include the road commission?
It can, if we'd like it to.
But if it doesn't, and we've already had resistance, including legal, how do you perceive, if they don't want to do that, your study, to modify a road,
Well,
intersection, where do you come in on
it's
that?
their jurisdiction as of right now.
It's
today.
their jurisdiction, so there is
So
no,
it's- Yeah, I mean,
But
well, regardless of, whatever happens with, I know that's some things being proposed.
Yeah.
We would work with the county road commission certainly, or whatever entity or group is in charge of the jurisdiction of the county roads, so. Oh, yeah.
essentially though, this opens up more federal dollars to flow into the county, especially with USDOT, like he touched on previously, because you have to have this planning intact so they can see the data. So it doesn't necessarily fix anything right this second, right? Because the grants,
It's a year or two, years
Right.
ago, I can see that.
but it does start some efforts moving forward
But
to
the
put in
point- the
structure,
point
to
is,
put in
Chairman,
a plan.
the point is that unless, depending on what the decision of the board is to take it to the voters on the question of the road commission, if the road commission prevails, they still have final say and can reject 2 years of study. There's no obligation for them to even consider it. I mean, it's a probability, is it likelihood? And today, probably so. Then, I'm not exactly sure. But I'm just trying to put this in perspective in terms of what's the best for the county. We're going to spend $80,000. They still open up other federal grants. I mean, I understand that that's a good thing. But in this particular situation, we have to understand our limitations as we're setting a precedent for the future. Now, what if within that 2 or 3 years, we decide financially otherwise to opt out? What happens then?
I'm not sure, Daryl, what would happen if, in the middle of this grant funding, if they decide to opt out of completing the study. Oh.
I'm
Daryl.
muted, sorry, I was muted.
Okay.
Once you sign the agreement with Federal Highways, the moment you sign it, that money becomes encumbered in terms of now the money is yours. You can't back out once you sign the agreement. So you sign the agreement and you move forward, you have to do the planning. If you don't finish for whatever reason, I've never seen that before, but I assume the federal government would try and claw back that money.
All right, no further questions, Sean.
This grant closes at the end of May, so
May
Correct.
26th.
there is an opportunity to work with GIS. I noticed that was mentioned in here. And we talked, and I think I mentioned about the automated directional programs that you can get on your car radio or whatever. And the lack of stop signs being included in that, is that something, if we went with a program like this, could something like that be implemented to put in stop signs into all of those programs so people knew where stop signs were? Because we're rural. It's like if you go on MapQuest and you program in your destination,
Right.
and it says you're going to go 35 miles down the road, and it doesn't ever include, and especially in the rural areas here, we've got stop signs where on the main expressways you don't. Is that something that could be included or plugged into them?
So I
Into like Google Maps or.
Yeah.
I think that I'm not sure how they get their data for that. I'm sure they work with county, local, GIS departments to collect that data. But yeah, I think if you have your GIS data up to date, and they request it, and, for their map updates, then I'm assuming that's how that works, right, Daryl?
correct. Yeah, most Google Maps or Waze or whatever references state or county level GIS data, whichever is the best that they can find. So if we plot all the stop signs, for example, or all the signals, there's a better chance that Google Maps or Waze will have that input then or information on their system.
And we're happy to work with the road commission on this if that is what you were getting at moving forward. But essentially, I just wanted to see efforts put in place and sort of a structure so we can continue that planning throughout the years to come. So,
Any more questions for now? You said, when's the deadline on this? It was May 24th or something?
May 26th.
May
May
26th?
26th, but Daryl, we probably need, how much time do we need to get this prepared for submittal?
So we need a couple of weeks. The application itself is not hard for us to put together at all. Biggest thing is making sure we can get the signatures from everybody, in this case from the commissioners, and then being able to make sure we have like the UEI and the TIN number for the county, which shouldn't be a big deal, but just some little things we've seen in the past that kind of come up.
And we're doing this effort for free. We're not charging for this
Correct.
time and labor that it takes to put towards this grant submittal. So.
Any more questions right now? Well, let's back at the next committee of the whole for final discussion.
Yeah,
Okay, thank you.
Thank you.
Thank you.
thank you.
Medical examiner proposal contract amendment, Mr. Mike Miller.
Yes, Commissioners, as you may be aware, the Dr. Maroney's contract expired in December 31st. I reached out to our attorney. She drafted a 180-day extension to that. That's the only thing that's going to change. It goes from January 1st to June 30th. All the remaining contract terms are the same. It's just we're changing the date just so we have him under contract. And that will hopefully gives us enough time to review the proposed bids that we have for us today.
Any questions, Mike, on that?
Jordan, I got a question for you.
We figured, yeah, go ahead.
Dr. Maroney aware of the contract extension?
Yes.
Yes, he is.
They were doing, we thought that, and the attorney thought, even when he was kind of continuing doing it, not under contract, it's better to have something in place.
Right.
Until you guys decide what you want to do.
Agreed.
So,
All right, thank you.
any more questions on that? Okay, next thing is.
Are you going to CA that, or do you want a motion for Thursday?
Motion.
Oh, okay, I'm sorry.
Thank you.
Hey,
That was gonna be my
Deputy-
next question. He
was
beat
that
me
your
to
next
it.
question?
Yes.
Okay, just checking because I'm just getting chewed out on something like that.
if that pleases the board, Chairman.
Motion, yeah. Okay, we'll do motion on Thursday. Okay. Road Commission. Potential ballot discussion. You've seen the motion or the ballot that language that our attorney sent us so far. I guess the question we have for the board is, what do we want to see at the end of this? I mean, are we looking to take over the functions of the road commission? Are you looking to reorganize and reorganize the board and appoint? This is what are we looking, guys? Talk. Because I think we need to have our bad language reflected on what we're gonna do. You know what I'm saying? So everybody understands that.
Well, I can tell, go ahead.
No, go ahead. I'm following. I was making some notes. Go ahead.
Just following up on my own experiences and the information that I've received. People are, I want to say opposed, but I'm hearing a lot of negatives about appointments due to the prior appointment situation that we had, where there was political influence and it didn't seem to work well from the appointed. The elected, there's a lot of people who are saying we want our elected, we don't want to lose that opportunity. Even though we're all elected, and we felt that the ultimate, we're the ultimate stopping point for people that have problems. And apparently that doesn't seem to have come to played out. The road commission is basically run by, there's a road commission, just like we are commissioners here. There are also the three individuals that actually are the working heads of the road commission, and make all the recommendations, prepare all the financial documents. And the commissioners take those under consideration and approve or disapprove, if that ever happens, any decisions that are made. That process seems to work. I've been told that there's a great deal of work and we're not capable of doing the job that the road commissioners are doing. I'm not sure how that conclusion comes up because they are elected at large, and for the most part, none of those people are road commission staff members.
You know, all this is good, but my basic, and I think the majority of the people out there, like you talked about, want to really, the majority out there want accountability,
right,
and checks and balances. We have to be that accountability, checks and balances. So whatever we do come election day, we have to have that on the ballot to change that. It's not, you know, in the process, you may give up their electability for that. But people I talk to, you know, you're right. They like to learn, but yet on the other hand, they want, I mean, I've had the township supervisor call me, who's been there 30 years, said, never once did they have a road commission person at one of their meetings to talk to them about anything. You know, they want accountability and they want checks and balances. How are we going to instruct that? To me, in a perfect world, I don't know. Would you know, you've got to disband them the way they are right now. That has to be there. And then they have to be reset. You can reset them by each district, bring their own representative to the board. You know, you apply through your district to be the representative on the road commission board. And the districts bring the recommendations to us that way instead of us handling them off from here. District 1, District 2, District 3, District 4, District 5, you apply there. Let the townships decide. I mean, I'm just throwing stuff out there, but
right.
I do know that the biggest question I have out there, and they agree. I think at the last open meeting we had probably had more in favor to do with this than against. The first meeting, I'm gonna say about 50-50, you know? But they do want accountability, they want checks and balances.
And how do you get that accountability?
You-
With the way it stands right now, we
You-
apparently have none.
You don't, you have to take it to the voters and disband the road commission, as you know right now. Now, you could maybe end up with the same road commission if they went back to the councils, wherever they're from, I don't know. But being appointed by this board, it's a lot easier to, like I mentioned there before, if they were elected by commissions, by districts like we were, I probably wouldn't even be challenged this, because then I would say, your districts are your checks and balances, like ours is. It's a lot easier to upend a district commissioner than if we were voted countywide. You know what I'm saying? It's a lot easier for your district to vote you out, to have somebody run against you, than it is if we were voted countywide. So, that way, I would say probably, you know, the districts were the checks and balances at that point.
Is that possible? Because I've heard back and forth.
Yeah,
different things
it
that-
is possible, it is possible, but again, if we look at it this way, it is possible to do it that way. It might not have been when the commissioners first done it, but through all the research, yes, it is possible to have it done that way. But again, if you go back to electability, in the time, which we can do that, but we lose our control again. But they're elected by, you know, we lose the influence we have, if they're elected. You know, so that's the decision we have to make as a board. What do we want to see at the end of all of this? You know, where we stand. Do we want to keep our oversight? Or, you know, we have to understand before the language is written. Now, the way the language is written right here is we're just going to get rid of them and assume their duties. I don't know if anybody on this board wants to do that, wants to assume the daily duties of the road commission.
When you say that to assume the daily duties of the road commission, what do you mean? Because the road commissioners, I don't believe, do the daily duties of the road commission. I
Well-
believe the daily duties are done by the engineer.
Well, they are, just like here, the daily
Right.
duties, they're done by the control.
Right,
office.
exactly.
Right, same thing, but, you know, to do that, we would probably have to schedule 2 more meetings a month, just like they do,
Mhm.
and handle, just road commission issues. We can do that. Do I think the people of Tuscola County want us to do that? No. But do I think the people of Tuscola County want us to be the oversight committee? I do.
Right.
You know
Right.
what I'm saying? So that's where we're at. You know, so I just want to know, you know, if I go back to Jamie, say, hey, this is what we're looking to accomplish at this election. You know what I'm saying? That's what we need our wording to reflect, that that's what we want to accomplish. You know? That's my feeling.
Go ahead, Mr. Bardwell. I see you're ready to go, so go.
Is it that obvious?
Yeah.
Yeah, I want to reflect back to Commissioner Barrios, the 210. The narrative, of course, would be that we had a lot of problems with the appointments. I don't believe we did.
I don't believe you.
I don't remember anything like that. I think it's just a narrative for discuss, you know, just for those who would like to use the narrative. At that time, and I don't remember exactly, but the discussion at that board during that time was either to bring the road commission to the board, which at the time the administrator was vehemently against it. They didn't want anything to do with it. Or to give it to the people in terms of election. All right. And there was something there was something going on at that time, like, I'd like to know, but I'm not going back to look it up, but it was 210. So it was decided to have it elected, and we had the discussion that the board will lose control. What happens? Well, at that particular time, the board felt that, let it go. Okay, fast forward 10 years later or more. We have seen some of the effects of that as it morphed into what it is today. All right, so related to the board selecting, it was done pragmatically through candidates. And then we would pick at that time, the board, regions within the county. And that was another concern, that they could all be, which we heard the narrative across the street, that no, that's no problem if they're all from Carroll or you know, a certain area. Well, that's not exactly true. We tried to keep it regionalized. We lost that, right? Now it's just elected. All right, so you lost that representation. If you can argue that, I don't have any examples, but theoretically, it seems like there is some underlying issues related to that. And we lost the ability from the board level to be involved in decision-making when necessary at the local level in the road commission. At the same time, until recently, it was my understanding that we had the authority to review their financials. We had that authority, and we set the wages and benefits. If that's changed, or do they have a different benefit package than we do? Well, I think they have a county benefit package. So that's something that you saw in the audit notes, which I mentioned across the street. What did you exactly see in the latest audit notes from the auditor? They gave the board that oversight. Well, their attorney apparently didn't believe that, but we'll set that aside. So let's go back to what the chairman was talking about. This issue at the lowest level has two primary causes. There could be more. One is the lack of road patrol. Okay, we have the funding, we don't have the officers, whether it be state, local, we don't have the road patrol to go out. Apparently, that's one issue because it's fully stated in public hearings with testimony of that concern in terms of speeding, and we all see it everywhere we go, and we know it's happening. All right, so there's one fundamental issue, and the mere fact that it became a law, you can't look at your cell phone. Well, we all know that that's hard to enforce and whatever. At the same time, social media technology has been increasing vehicular in your vehicles as well as the dependency you have on it. Let alone the kids in the back seat, the McDonald's hamburger you're eating or Burger King, or all the other traditional things we used to worry about. So put that all together. That's at the lowest level. But really what the chairman is talking about is accountability at the highest level. We have seen a lack of timeliness and responsiveness. And we saw a complete turnaround in our second public hearing, which was appalling. It was nice to see, but of all the arguments up to that point, I felt they had certainly put their heels to the ground, but to come in and say, now I feel remorse, whatever that was, we're going to put signs up, bigger signs, we're going to paint on the pavement. This is what we're going to do. Whatever that is, so be it. But it certainly didn't have a study. So it's the lack of the timeliness and responsiveness that 9 months later, that's appropriate. And it started with 9 deaths, come the other intersection, so to speak, and many others, and almost one a week ago. So the real question here is if this board is as the chairman has said, we need to bring back accountability to the decisions that are offset by common sense. We have policies, we have statutes, we had Matt Hewitt explained to us in very eloquent detail the legislation, but yet has it kept up with the social media influence and the current status of today? I doubt it. It doesn't seem to be that way. So what we really need to look at is bringing it all back. And I don't really prefer that because they had an opportunity since 2010. And obviously they believe they're doing the right thing. But those who come back to us who said in the meetings, including our own commissioner liaison, doesn't always project that workability. And that's why we had the grant. I was questioning the grant. Can the road commission negate that if it stays with the people? Absolutely. There's no reason that they wouldn't. based on today's observation. Now, the other half of this, above that accountability, Chairman, is what that structure looks like. And you're right, we're not going to run the day-to-day. We don't run the day-to-day of the county. But yet, as time goes on, I believe it's necessary to put in place a structure, whether it may be that there's an intermediary that does oversee the day-to-day operations. And we had that discussion in one form or another.
You know, and that was just, not to interrupt, but it was that way for years, Commissioner. And this board never pushed their way around with road width unless it was absolutely necessary. You know what I'm saying? Let them do what they want to do. But the option was always there. If there was a tie somewhere where somebody had problems, again, this is the last board of resistance for any department. And so, go ahead.
It's the board of last resort. It
The
used to
board
be
of
said
last
10
resort.
years ago, board of last
And
resort.
even before
still
this
is.
board, when it was the way that Terra Hoffer wrote those letters, they never interrupted with their business. They let them do mostly whatever they wanted to do. But they had the option to step in if needed. You know, they were the checks and balances.
And they didn't have, give the road commission some kudos here. They didn't have what we have today to deal with. They still have the roads, they're still functioning under that same platform of how they've always done everything in the past, but yet other distractions, other things have changed, which are not being reflected. So I think Commissioner Barrios said it best a few minutes ago, sensory attention getting factors. I mean, that was the rumble strips, that was the, whatever it was, the sensory part to keep people focused. But that's at the lowest level, and that's what we wanted to see. We were rejected. But Chairman, you're right. It needs to be brought back. And during those years of the 210 on, or before that, I don't recall the 5 years before that, any needful involvement in a road commission. It did what it was supposed to do on a timely basis. But yet today, I think there's a polarization on, you know, pick a subject that we heard across the street. But yet the real fact is, as the gentleman said today on the presentation, the near misses, we had no clue what a near miss is and how many there are anywhere until there's a response in the 9/11. So I think going forward, and it concerns me that we've gotten to this point, but I think the accountability and the timeliness needs to be updated to a point where now the only resort that people have is to go to the road commission board. Is that not true?
If they listen to you.
So I think from another perspective, I think a board of 5 at this point is much better from a viewpoint to discern the sides of what do or not do, or what can we do temporarily, or how can we work with law enforcement? What do we need to do? Because this has got way ahead of us. You can tell that. It's almost taken up all of our time when we should be thinking about financials. So I guess you said I was ready to speak, but I'm thinking at a very high level in terms of accountability, responsiveness, social conscious. Social conscious. I mean, I just, how many people you have to leave, that you have to lose across this county without any effectivity. So Chairman, I'll defer back to you. I think it needs to be moved forward because from across the street, it was pretty much parallel, polarized. I had a yes or no for everyone who presented, and only four four who I really wasn't sure what side they were on. They were more like in the
There's a
middle.
lot of them I didn't deal with.
And it was sort of an equal, but it was very much polarized into a lot of discussion that really didn't have a lot of effectivity in solving the problem. It was to preserve or not preserve what is existence today, depending on who spoke. But I do believe that I'm not sure of the language in terms of this ballot proposal to eliminate, and they were calling for something in between. Well, we would have an appointment.
Right, there, you know, like I said, with this language here, I don't think this is what the people at that public hearing wanted. But they did want oversight, they did want checks and balances, and they thought the county board should be the final oversight. But the majority of them did not, I don't felt, said, hey, we want the county board to take over the road commission board completely, blah, blah, blah. You know, there's a lot of things you can do with the statute. I mean, once you can eliminate what you can give some powers to this board, you can give some powers to that board. You can, you know, there's all kinds of different options you can take, except that we need to figure which, like everybody kept saying, well, what's your plan? What's your plan? Well, we don't really have, my plan is, which has never really changed since I got elected, because when I got elected, I go to all the township meetings. The biggest complaint at township meetings was the road commission. On every meeting you go to, they don't listen, they won't communicate, they won't this, they won't that. You know, my plan was always, we just gotta have checks and balances and oversight. My plan was never to get rid of them 5 people and just take over their job. You know, I never really want, but we gotta have some kind of oversight.
I'd just like to share with you that Julie did mention again about implementing that 2 and 2 problem solving group. And I told her that I would suggest that or make that known again. We had a very interactive meeting at the last road commission meeting last Thursday. The topic of the financials, and I'll bring this up, you know, just because we've discussed it here, not having the financials. The audit will be done sometime the end of this month, and then they submit the audit to us, which we need for our audit. They schooled me on that. As far as doing a financial report, I was told, you sat in on the budget hearing in December, why don't you give a financial report? Why don't you ask your controller administrator to give a financial report? They have all your financial data. So it was very.
Right there, that's the issue right there.
And I said.
That's the issue.
What if you got a question?
You know,
I asked that, I said, that would be like me giving you my checkbook and you telling me, giving me an observation or an interpretation of what my financial stability is. I said, what if somebody has a question? And that kind of landed up being a moot point. We have the financials, we have the financials, I was told. And so basically we have what we need. I felt that they did not feel that they needed to come in and speak. I shared with them that we had recent annual overviews by 3 of our department heads, and that's what we were expecting. I said, what about projections? We don't know anything about what's going on in the organization and in the road commission future. But that discussion, it didn't go well.
When I first got elected, we did have them in there a few times for friends, and they never gave us any problem doing that before. You know, until all this comes down, they never gave us problems. Mr. Tech would come in here and he would give us his financials. We never had an issue doing it because we do have financial oversight to this day. You know what I'm saying? Till this day, we do have financial oversight. But that's what you know, I'm going to. But I think somehow I would like to, if it's okay with the board, I'd like to take this back to Jamie and relate to her what we want to accomplish out of this election, to see if she can change this word, you know what I'm saying? And say, this is what we want to accomplish. I don't know if we want to accomplish that. I think if it goes to the ballot in this language, not a fair will, because that ain't what people really want. You know,
So Chairman, would you suggest to Jamie that go as far as that part of the structure is that the board would appoint, and somewhere in language, oversight
yes.
to that? Because I think that would give some structure and that would leave the board prerogative at that time, whoever that may be, and there's been a few suggestions roll out of the meetings, but that might be satisfactory for those who think we're going to do the day-to-day operation. And again, that's another narrative that plays in the role of why you shouldn't.
Right.
But I would suggest that if the board would agree.
That's what I would.
Chairman, I just want to say, checks and balances, accountability, you know, if they'd have done what they did before that meeting 9 months ago, we wouldn't be here today.
Right.
Well, we still might be here today,
Well-
because I've been trying to get here since
Well,
2017.
I don't think it would have come to a head.
I don't think it'd come to a head, you know, we've asked them to come here and we've, you know, now this guy here, he comes out, this guy was just up there, said, well, he could get this study done in 24 months. If they'd have come here and said, hey, look it, we're gonna do this, this, and this, and in 24 months, we're gonna have a study, I think the fire would have been down a lot. But just ignoring and no checks and balances, it gets people riled up. And I'm one of them.
And I think as a board, we all think there should be checks and balances, and
Sure.
accountability.
Yep.
And I do the same thing. That's why I'm asking the board, you know, to let me have that conversation and just say, this is what the board wants to get out of this. They don't necessarily want to get that. Now, she may tell me, she says, Kim, that's fine, you can do that, but you should have to have that language in there. You know, since you can tell me that. I don't know. You know, so you can do that. Once this passes, you can do whatever you want. But this may be the language you have to, I don't know.
So is that how you say we get to this here, checks and balances and that? Is that what you're saying we should do, or?
Well, I would like to go back to Jamie. So Jamie, this language, this ain't a consensus of the board. We don't want to take over the day-to-day
Right.
the operations of the road commission. We want to be able to appoint them to districts. We want to disband them, but this is not what we want to end up doing. Well, she may say, well, that's fine, you can do all that, but you might have to use this to accomplish what you want to do. Or she could put in the language what our intentions are, which I would like her to do for people to do when they would, you know, about what our intentions are.
The Chairman and Commissioner, the check and balance is sort of a granular, that's an accounting financial term. It's we more are looking for accountability to the people. When the people come to the board and they've exhausted the avenues, the board has to have some leeway for evaluating the authority of a decision that might have been made. And then, as Julia is saying, you know, she's requesting 2 and 2 negotiate. Ladies and gentlemen, I'm not sure what we'd be negotiating. There is nothing to negotiate in my world. Maybe in your world there is. There's nothing to negotiate at this point. But perhaps under a different arrangement, that discussion would be appropriate. But keep in mind, whenever we get 2 and 2 together, 2 of us together, that's an open meeting. There is no closed door. You got to post that and you have an open meeting.
Our policy says it is. It's not really an open meeting, but our policy says it. You know,
Well, as long as our policy says until it's changed.
Our attorney
But-
opinion says it's not.
I disagree
But-
in a sense because the court case, I don't remember, was the fact that what they didn't hear from a public view that was reported back, they didn't hear everything, and that brought that case. Now, I don't know how that turned out, but you may be right.
But anyway, yeah, I don't see it anyway.
But at any rate, negotiability factor is what would we negotiate? But I go back to the fact that we need some structure placed in this that gives, unless Jamie says, don't just leave it open, legal.
Well, you're right.
Have something there that the public could, oh yeah, okay.
Maybe I should just talk, hey, what we want to count, the public is trying for us to be the checks and balances. How we put it in the language. They're gonna take away their being elected. That's a given. If you ever want to get the checks and balances that, if they're elected under election laws, there's nothing you can. So that's like giving, you know what I'm saying? You have to do it.
So you can't have us be a stopgap at the top, even though they're elected. They're the final thing. We
Well,
can't
that's the
have,
problem we run into. And again, that's a question I would propose.
Well, like Commissioner Bardwell said, though, there's nothing to negotiate. They already got the hammer. If they don't want to do it, they're not going to do it.
They are a sole entity
Right.
except for financial, some oversight which hasn't been defined or redefined, financially and benefits and salary. But I would certainly, I go back to the check and balances, that's a bit of a, whatever legal comes up with, but checks
That's
and
the
balances is
issue.
what we do to check each other financially and make sure we.
But it would be nice to have common ground.
That may be in the future.
You
Yeah.
know, but I think we'd all like to see the buck stop here and checks and balances accountability. So I think I need to go back to say that's what we want to accomplish out of this whole thing.
Mhm.
I would do that through this battle. So that's what we got out of the meetings basically too. You know, out of the meetings, that was basically, you know, they do want accountability and checks and balances.
Well, at
Most
least half of them did, the other half.
Yeah, it was about 50-50.
Well, the
Not
most of them
sure.
just want to take it to the voters, and I think that's a good idea. Take it to the voters and see what they want.
We don't want to get this right. I'll make sure.
Right.
This is right. So let me do spring and I'll bring it back to next committee of the whole, because the following meeting on Thursday, we're gonna have to vote it in, language and all. The last, committee meeting, we'll have to vote it in at that point. Okay, any more discussion on it? I know people have been waiting a long time. You want to take a little break before we go into
Yeah, that'd be good.
old business?
I'm good with that.
10-minute recess, guys?
Agree.
quick,
You all ready? Go back at it.
Yeah, I'm upset.
Go back in session. Appreciate the short break. We'll move on into old business. First thing on old business is medical examiner request proposal. Mike Miller.
Yes, Commissioners, I have, the bids were due on Friday, and I have 3 here to open, and my intent is to open them. There should be a bid sheet with some basic numbers that I'll give you, and then from there, I'd like to take them back to the committee that put the RFP together and let them review it and come back to you with a recommendation. I do not expect that to happen by Thursday. So,
Sound good to the board?
first bid I have is from Dr. William Maroney. Let's see. So we asked for 2 options. The first option for a total base bid was to provide a full suite of services, including transportation, autopsies, cremation permits, fees as set by the county, and scene investigation. Dr. Maroney did not choose that option. He chose option 2. He has, for a flat fee for acting as medical examiner for Tuscola County, authorization of cremation permits and death certificates are included for $30,000. An autopsy fee per case of $2,400. Scene investigation and transportation fees of $540.
So it was $30,000 for what, Mike?
For his services as medical examiner
$2,400 for,
for autopsies.
okay, so that's all up.
And then 540 for the crime scene investigation, well,
That's per.
scene, yeah, it's per,
Yeah, that's what,
and transportation.
Is this 3-year contract, Chairman, or
how many year contract is this?
This is a 1-year.
1 year?
Are they all 1 year, Mike? You know?
Unless they're noted, that's what it's
Okay.
for, right, Steve? We did a 1-year contract, yeah. The next one I have is from Daniel Spitz. This is from Michigan Forensics. They also chose option 2. So a flat fee for acting as medical examiner for the county, authorization of cremation permits and death certificates are included for a price of $33,750. Autopsy fee, $2,400, which includes the transportation. And then scene investigation and transportation per case is $165. The last one I have, Mid-Michigan Medical Examiner Group. They did not choose option 1 either. They are going with option 2. There's a lot of numbers here, but I will give you, this includes, they have broken out revenue, administration fees, forensic pathology, MEI case investigations. All comes down to $145,996.
That's for everything.
Yes, from what I can see on a cursory look, yes.
For 1 year.
$145,996. And I will reserve the right to say this one's going to take some time to go through all the numbers. But that is the total they have at the bottom.
Question, Chairman.
Yes.
On the, for those who did the bid process, who, you all selected number 2 and number 1, I may be wrong, but was something about transportation, right?
Yes.
So who picked up the transportation?
It is my understanding, and Steve Anderson can correct me if I'm wrong, but it's my understanding that Ransford, Mark Ransford's funeral home picks up the transportation and doesn't charge anything.
Is there a reason for that? I'm just curious. Just goodness of the Ransford Collins? Or is it because they have 22 units to refrigerate or?
He doesn't do every single death,
Oh,
only those that are, through Dr. Maroney, where there's gonna be the autopsy, and then he does all of those transports.
okay.
If someone has something arranged with another funeral home and there's not gonna be an autopsy,
It goes to
there's
the,
different, the other funeral homes pick that up.
Chairman, so I have a question. So let's say Ramsford picks up the body. If I'm my understanding right, they do the exams in Midland. Am I correct?
That's where Dr. Maroney
Okay,
does it.
so Ransford does that for nothing. He picks them up, takes them to Midland for nothing?
That is what Mr. Ransford explained to me, yes.
Pretty generous.
if, Chairman, if Mr. Ransford didn't pick that up, or hypothetically, who would have the responsibility to pay it?
Well, Dr. Roney's supposed to be doing it, isn't he?
Well, that was the issue, is
That
that,
was one of the issues
that's one of the issues.
that's why Ransford just started doing it.
Right, that's why we, or as the committee was very specific to make sure transportation was included in their bids.
But again, the question was, who would be responsible if he didn't for That's in Tuscola County.
But see, ultimately, the county would be.
Yeah.
I knew the answer, I just wanted to hear it repeated. And does anyone have a sense of what that amount would be per, or does it vary? Probably varies. I don't know.
I don't know.
So he picks them up at the crime scene, takes them back to his place, and then takes them from his place up to Midland. Is that what I'm getting out of this?
I don't know the exact procedure, but I would guess yes.
And he don't get paid for that?
He does not.
But we didn't fix that in these contracts
We did. We asked the
to
new,
include
to
the travel.
include that cost in their bid.
So going forward, we won't have that issue.
Correct.
Chairman, was this a privilege that the county enjoyed for a period of time? Do you suspect this may be a closing privilege where the county would have to pick it up?
No, in the current way we have it laid out now, it would be the medical examiner's expense. That's why we asked them to include it.
Okay, so the way this reads, I thought number one included transportation, number two didn't.
No, number 2 does include transportation.
Oh, it does include.
Both of them included transportation.
So it remedied the situation.
It will, yes.
Okay, no further questions.
Okay, so Mike, I guess take it back and go over and report back to the board.
We will do that. Thank you.
JCL security contract renewal.
Morning, commissioners.
Morning.
With my imminent departure, I would like to get this contract extended a little bit beyond this, so nobody has to worry about it. The current contract we have expires September 30th, 2026. That's with JCL. That's doing the lobby and vascular services. With this extension, we would extend it to December 31st, 2027. There would be an increase from $42.50 an hour that we're currently paying to $45, and that increase would occur on September 30th of 2026, moving forward to the end of the contract, December 31st, 2027.
I'm sorry, Steve, September 1?
So it would take effect, the $45 an hour would take effect the September 30th
Okay, thank you.
to December 31st, 2027. And several of us had a little meeting about this moving forward. Obviously, there's going to be some different ideas possibly on this moving forward after December 31st. But with everything kind of in flux right now, with me leaving, with Mike being interim until somebody's actually named in the controller's position, we figured this would be the best avenue to go forward for right now.
Chairman,
Yes.
who funds this? Does the foreclosure fund,
Yes, sir.
is that in jeopardy with that legislation that
Perfect.
using the
Perfect
money?
timing.
I will defer to Ashley Bennett, the county treasurer.
That was pretty quick.
I really see the walk here, that's right.
But I missed the question on my walk here.
I,
Tax foreclosure, any problems, basically.
Problems in the future funding wise?
Yeah.
in other words, with the foreclosing legislation and all that was going on the foreclosures, does this jeopardize the funding that you've been providing for the future?
No, I don't believe so. But I believe there's a conversation coming down the pipes later in the future about discussion on including this, not through 27, not through this contract. The foreclosure fund is going to fund the entire thing. But moving forward, there is potential about wanting to shift the cost to all of the departments within this building.
In other words, to not use the foreclosure fund, but shift as a cost.
Correct.
Do you have that in your mind what that would be?
What would that cost be to each department?
Yeah, and how would you apportion that? How do you,
So that conversation has not taken place yet. They're just like a very high level looking down. But obviously, like I said,
checking.
everything is kind of in flux right now. So we figured this would be the best option to go up until that point. And you guys can talk about that
future.
And
This
you,
contrast keeps everything status quo and just pushes it till, we would be, it stays the same until January 1st of 2028.
okay, for the rest of the year.
Yeah, so it gives us time to have those discussions and weigh the options and look through.
2028?
This would take us through December of 2027 by approving this contract.
Oh, through 27.
And it was, yeah, so January 1st of 2028,
Mhm.
we wouldn't have any coverage
Right.
and we would need to discuss what we were doing
Okay.
prior to that.
That's all, Chairman.
So we can put this on the consent agenda?
Thank you.
Thank you.
Mhm.
Thanks, Ashley.
MAC 7.
Well, we're having a MAC 7 meeting today, so these are the old notes, and you can see that I talked about this earlier, regionalization.
Today or Wednesday?
It's today. Because of Easter, they postponed it until today.
Did you see the email, Commissioner, from Lapeer?
Oh, are you talking about MAC 7?
Yeah.
Yes.
Oh, I'm sorry, I'm talking about MAC. Never
Okay.
mind. MAC 7, let's back up a month. I did see that.
Okay.
They wanted to shift it, I mean, it's Wednesday. I have a meeting on Wednesday. Normally we have it in the morning, but did you contact Huron County? Have you heard from Huron County?
I have not. You had asked about the meeting, so I reached out to Lapeer. Lapeer is in the middle of software updates and they aren't going to be able to host the meeting Wednesday. So if you want to continue the meeting, somebody else would have to host it.
Well, Chairman, I would suggest that we reach out to Huron to see if they would like to. Or, it's usually at 9 in the morning. I got a meeting at 11.
I don't believe that there's been anything prepared, like an agenda or anything.
Not at this point. Or is it the prerogative of the board to postpone it until the next?
I think a lot of confusion.
Yeah, there is.
Yeah,
It'd be best
Just postpone
postponed.
it.
and postpone it to the next.
And could we have a email sent to the participants here and relating that?
I will.
That here and be us? Because I don't think we are until the fall.
There is a schedule, but I don't have it. And I will find out. I believe you are next. I believe.
After
This meeting of Wednesday would have been Tuscola next,
okay.
I believe.
Yeah, I don't remember. Okay.
But I'll find that out and I will email everybody and let them know.
It was easier than Mac, so.
All right. Moving on to finance technology, and I'm gonna turn it over to Commissioner Barlow.
First on the agenda, we have the 2026 equalization report by Angie Daniels, our equalization director.
Good morning.
Good morning.
All right. Hopefully everybody got, I think everybody got they have the report, plus there's one chart that I updated that I'll go over. So you've got a separate sheet, just keep that handy. So we'll need that. Does everybody have, I think everybody's got the report, so we should be good there.
Yep.
All right. All right, I'm gonna just try to jump to the good stuff for you. If we turn to page 3 of the report, that's where we're gonna start. First, I want to go over that we are pleased we've completed another year of studies in assessment administration in our department. This year, Tuscola County Equalization conducted 890 appraisals in the agricultural, commercial, and industrial classes. We studied 796 arm's length sales for this year's residential sales study, and we audited 211 personal property parcels. All data used for this study came from the 2-year study period of April 1st of 2023 through March 31st of 2025. And all appraisals and sales information were compared to the 25 level of assessment in each class within each local unit. Then each year, those study results are shared with local unit assessors and the Michigan Department of Treasury Property Services Division staff for their review, audit, and comment. And then studies are finalized on December 1st. Assessors then utilize that data to prepare their local unit assessment rolls for the coming year, the results of which are summarized in this report. So these are our shiny new numbers for 2026. So starting on page 3, our top chart shows us our change in SEV by class. This is a chart that we always present. So this tells us what the overall values have done in each class. You can see, agriculture, for instance, we saw quite an increase this year. A lot of that was actually on the east side of the county, surprisingly. And personal property was the only class that we saw an expected slight decrease in value. And then that bottom chart is the chart that I did change that this year. So this is the change in taxable by class. And these taxable values, these are the values that get applied to our millage rates. And so this year, typically in past years, we had excludes rent zone because rent zone only pays on school debt. But this year, I did add the disabled veterans exemption value because it removes almost 28 million in taxable from the county. So a lot of information that we report to the state, or just if we're having millage discussions, or there's just a number of reasons that we've got to back that value out because they don't pay on any of the millages. So I took those figures out of the 25 and 26. So you're seeing about a 2.72% increase in our overall taxable value for this year. Rent zone, that exemption accounts for just over 7.5 million. So the 28 million and the 7.5 million, that's what's coming out. But Dairy Farmers of America, which is the rent zone property in Elkland Township, that is actually this year, starting for 2026, that is going to start returning to the roll. So from a tax revenue standpoint, that's a good thing for us. So it comes back on at 25% this year, it'll be 50% the following year, 75%, and then it'll be fully back on the tax roll. All right. Turning to page 4, this is our usual, this is just looking at the real property breakdown of each class. Nothing much changes from year to year. And then page 6 is just including personal property. Okay, and then if we turn to page 6, we've got our wind versus non-wind chart at the top. This is one that we included a few years back because I have a whole separate spreadsheet where I talk about this each year. We track those wind park depreciation, which is that top red line. You can see, just as we always state, that value just, it does go down. So unless we have any repowering of equipment or any new development, that figure does depreciate every year. And then, this is just personal property in this top chart. But that bottom line does show the non-wind personal property did see a slight increase this year, which is typically don't expect to see that because so much of our personal property is exempt nowadays. So I did do a quick look just to see, which units saw a decent increase. And Dayton Township had a decent personal property increase, and it was actually looked to be fiber optic installation, which we know there's been a lot of that going on in the county. Elmwood Township, it was primarily consumers and DTE that reported some, so I'm assuming they too are putting in more infrastructure. And then City of Caro, and that was just, I think, just general new personal property accounts that exceed the exemption threshold, so they do get taxed. So turn to page 7, and this is another chart that we just always present because it just gives us that 10-year view. The top one being our equalized or state equalized or assessed values as we call it, and then the bottom being the taxable value. And if you turn to page 8, these are 2 new charts that I put in. Each year I try to just convey what I think we need to know, basically, and try to summarize it in a fancy chart, of course, because we all like pictures. So this top chart, I like looking at this because to me, it does tell a story. So you can see that the real property change, for the most part, we do see an increase, but the personal property is the one that's been interesting. Just kind of looking through that chart, 2016, for instance, you can see the personal property takes a pretty decent dip. So it's like, well, what happened there? And that was wind park depreciation, and it was the start of the eligible manufacturing personal property exemption. So right away, when I look at that, I'm like, okay, that makes sense. And then in 2017, business as usual, right? We see a little bit of personal property depreciation, and then, of course, we see our real property increase primarily due to inflation. 2018, we see personal property go up again. Well, that was the completion of phase 2 of Crosswinds, which is our one wind park. 2019, we saw the construction begin for the Pegasus Wind Park. 2020, they completed the construction of the Pegasus Wind Park. And then in 2021, we still saw an increase in personal property, and that was that quality roasting facility in Guilford Township. Then you get to 2022 and forward, and that's where, again, this is kind of our typical scenario now, okay? Our personal property just continues to depreciate. Our real property, we saw, well, you can see even in 24 and 25, if you look at that top chart, okay, you can see, well, actually 23, 24, all those years, we're seeing what looks to be a good increase in taxable value, okay? I do want to draw your attention now to the bottom chart. Shoot, I haven't been, I'm telling you, I'm not used to doing this one. All right. Sorry for the people watching online. You can see the direct correlation. So 22, you can see the blue line on the bottom chart is what our inflation rate multiplier is. So tied to that CPI term that we've been kicking around earlier this morning. You can see it's like 3.3% in 2022, and then in 23 and 24, those were those peak years where we're seeing 5% inflation. 25, you can see it drops back down to 3.1. For this year, it was 2.7 because we have seen inflation drop down a little bit. But look at how closely, if you're looking at that percent change line, or if you're looking at our real taxable values, barring any economic development or any significant change, we're pretty much following right along with inflation. So that's where I tend to heed, like right now, I think there's a lot of uncertainty globally. We are seeing, inflation. I think right now, the latest figures I put in last week, we're tracking at like 1.9 right now for 27. So that tells me we're probably going to end up at 2 point something maybe again for next year. But it just, I guess, solidifies that right now we're not going to see the 5% inflation like we did back in 23 and 24, I don't presume, but we're just running kind of status quo right now. So like I said, barring any major economic development, we're just not seeing a whole lot of movement, anything, significant, okay? Any questions on that or anything thus far?
What page are you on?
What page are we on right now?
Yeah.
Is that what you said?
Mm-hmm.
We're on 8. With the 2, well, it'll match the chart that I finally caught us up on the projector there. And then if we move to page 11, that was the next one that this one hasn't changed a whole lot either. This is the one that, again, you see Columbia Township, Fairgrove Township, Guilford Township, those are all of our wind townships. So, their taxable side just continues to see that depreciation from the wind parks. But you can see we did have a lot of growth, especially in SEB. We did have, some units. I mean, residential still very strong. So we're seeing, every year we see, prices increase. That coupled with ag, we saw a lot of ag increases. The only problem with that is all that value is capped. So we don't see much of an increase on the taxable side. And then if we turn to page 12, so this one, I apologize, we should turn this one sideways, but we're just gonna glance at it. This one hasn't changed much either. Our top 10, so the top chart is equalized value, and then the bottom chart is taxable value. But again, this has always just been one that we like to include because it does show where our top revenues are coming from, which is primarily utility and agricultural. So
So Angie, can I interrupt you for a minute?
you sure can.
So back on page 11,
Mhm.
where it shows the equalized and the taxable.
Mhm.
Okay, some of them, I'm just gonna pick on Watertown Township. It went from 4.49 down to the 9.20. What's the drive on that? And what caused it?
Well, it's going to be a combination. So that 9.2% increase is going to be, that's equalized. So that's just overall value increases. So, you know, I do try to look at each unit. So similar to what I did with the personal property, I try to see if there was anything significant happening. But you can see probably for Watertown, most of that is probably residential increase. I think they also saw quite a bit of agricultural land increase. Prior years, we kind of had them off on their own separate, you know, we studied them separately or actually studied them more with Lapeer County because that's the values, the data told us that. But actually their latest sales the last few years have indicated that we need to group them back with the southern townships. So they saw quite a significant agricultural value increase.
All right,
So,
thanks.
Yeah, you're welcome.
Question?
Yeah.
Fairgrove Township, I know they've got a 100 megawatt battery project that's proposed.
Correct.
Supposed to be done in May of '28. That will be reflected then at that point in time?
Yes, yes. Yeah, because it's supposed to begin construction in 27. So yeah, we'll start seeing values come on for the 28, which I did check with Huron County because Jason just, you know, he's taken in all his latest numbers and they're 200, they have a 200 megawatt battery storage facility. And I was kind of comparing because that one in Fairgrove is slated to be 100. So I was trying to get a gauge. I want to say it's going to be approximately maybe 15 million. It'll, you know, if I'm just gauging it on what was reported in, what is that, Colfax Township? Yeah, just to get an idea of, yeah, what do we have in the works? You know, do we have any projects that are gonna give us some additional revenue? So yes, good question. Any other questions or any other? Yes, Mr. Barlow. I know he's.
Chairman, there's a lot of data here. So Angie, morphing this into a Cliff Notes version, what can the county expect in the future in terms of property tax related to our financials?
No, that's kind of where I was, like my earlier statement, aside from, you know, shaking the crystal ball, the biggest thing, if barring we have, you know, battery storage facility come in or repowering of our wind or, you know, what happens with the Arvila solar project, barring all of that, we're kind of just following inflation right now. You know, our tax base is going to increase only by that rate of inflation. The only time that that's different is when we have new construction. So again, unless, you know, depending on, you know, what we have going on economically, we're just going to stay with that rate of inflation. And the thing that's concerning is when you do start going from like a 5% down to, was it 3.3, then 2.7, then, you know, it's like, it's kind of a double-edged sword how we want inflation to go down personally, but for those of us, you know, entities that are levying against those values, that can start to hurt us. So, but I don't, you know, that's a big question mark right now. Like I said, especially because of what's going on, I feel like globally, you know, it's a huge question mark. What is going to happen with inflation? You know, what is going to continue to happen economically? So that I feel like is something that, you know, we'll try and watch it as close as we can. We get, you know, monthly CPI figures, but as far as looking ahead, that's hard to do.
So what, reframing what you just said, following inflation, you can take what we got last year, add the inflation to it, and we get it this year.
For the most part,
Barring
yeah.
everything else stays the same.
Mhm.
No huge increase in construction. But an egg is carrying a lot of it.
Mhm.
What do you project is going to happen?
Well, my other concern would be, what are our legislators gonna do? Because there's a lot of pressure. We've got taxable values and home values at an all-time high, right? There's a lot of complaining about, we got properties uncapping at these extremely high values. So people are, purchasing homes that following year, the taxable value uncaps, they're crippled by their tax bills. There's just a lot of difficulty there. There's an issue too, because they also claim that because of that, that's keeping a lot of people from wanting to potentially move, that coupled with the higher interest rates. So we're, again, dealing with that issue of a lack of inventory. People aren't moving. Younger home buyers, we would hate to be in their shoes right now. It's that's why I think we're seeing a lot of that younger generation, they aren't even purchasing right now because they just can't afford to. So our legislators are in fact, right now, I wish I could remember the number of how many states right now in the US are looking at some form of property tax reform. I mean, we've seen the headlines for Florida and some other states, but there's actually I want to say it's in the teens as far as how many states have active pieces of legislature that they're trying to pass right now to relieve, provide some relief on the property tax side. And so that's my concern is something is going to give. They're going to try this, I truly feel this year they're going to try and either reduce that. I've heard they may reduce the cap, or I've heard that they may do something with the uncapping. So that directly equates to a cut in our revenue, right? So, yeah, so we need to be very, very cautious right now. That's why I'm trying to, I guess from my perspective, we need to really run status quo at a minimum, but just be very, very conservative because we don't know what's coming.
From your sense, do you believe the current governor is supportive of uncapping or some type of remedy? Because that's where it's going to end up.
I do. I think that's why, well, we've had the Axe My Tax initiative now for the last few years. The problem with something of that scale is finding the replacement revenue source, right? And that's what's made it so difficult for even other states, because I have been following, some of the other stories. It's very difficult. At the end of the day, we still have to pay for all these goods and services and infrastructure, and the money's got to come from somewhere. It's just, so if you eliminate property taxes or reduce that property tax burden, it's still got to come from somewhere, right?
So this is hypothetical, Angie. I'm assuming agriculture, which has been cropping up, and something happened to the west, you said?
The east side, actually, but all of that value is capped. So it doesn't matter, it could go up 50% and it's only going to go up by the rate of inflation, each property.
So hypothetically, non-proven, just hypothetically, it appears that over the last several years, our industrial base has declined. Therefore, there's less opportunity. Coupled that with the housing situation for young people, they'll exit. And the fact that ag has been moving forward, but in the recent stats, I believe I read ag has dropped 23%. I'm not sure where that's going. And yet, economically, we've developed an infrastructure that has, as you said, has to be paid for by a tax base that is eroding with the population, which is a 3% drop because of the fact that the schools are starting to consolidate is a good indicator. Looking forward, it would seem that I can see where the scream or the cry of the taxpayer, because the fact of the matter is, issues that you just mentioned in uncapping is made it untenable at the wage, the ability to earn other than ag, which is questionable at times. Well, also 46% of the ag doesn't make a profit, but this is where we're going. So that's what I'm asking you about. For the county's future financial stability, you're saying follow inflation. I expected something different. I was expecting, yeah, you're gonna drop, please, I don't know, 500,000. Something's gonna happen here because this can't continue. There's where I was.
Well, the other, and that's partly why I added that revised chart in here of the revised chart where we're now excluding the disabled vets exemption. We love that our vets are getting that exemption. But it's if I put in a diagram of where that started and where it is now, 28 million in taxable value. So not only are we having to be careful going forward, but that's a number that's been increasing, right? So that's cutting into our, what we're actually receiving in revenues. Just like that those rent zone properties. I'm trying to think what else. The personal property exemption, first it was let's exempt everybody under 80. Now let's exempt 80 to 180. We do get some of that revenue back, but it's just, every time they want to provide relief to the property taxpayer, it's going to come at a cost. Again, cost of goods and services are only going up, right? So it's like, at the end of the day, there's just, I know you wanted rainbows and sunshine and good news, but we have to have economic development. We have to have, things being built. We have to, if we want to see an increase outside of our normal numbers.
So in summing up what you're not saying, maybe what you are saying, what is your advice to the board in terms of financial?
Don't spend money. If that's truly what, it's hard, but I'm looking at the largest revenue source and I'm like, it's not, like I said, when you see 2.72%, you think, oh, we went up, but how much has the cost of everything in the county gone up? I feel like are we even breaking even?
No, rate of inflation or more.
You know what I'm saying? I know all of us department heads who watch our budgets and watch our expenditures are everything's going up. I haven't seen a discount on anything, and I'm not the best example. My budget's pretty small, but I'm sure, someone like Ian here can attest to, every year, our BSNA software is probably a great example of that's coming down the works. So that's where I think it's important too. And I know Mike's doing, he's putting forth a valiant effort to have those budget talks with department heads and have our meetings so that we can not only be keeping a very close eye on our current budgets, but also what are those bigger ticket items that we've got to account for in the future?
Well, I think the mystery is we pulled 1.9 from somewhere, which we never knew existed. Any commissioner prior to that time probably would have said no, because we've been running lean. No, not good. Apparently not. So it appears that we're going to go into a decline at some point because unless there's a replacement for revenue,
right?
There is no, and
like
agriculture
said,
can't sustain it.
Well, just like I said, we've got that battery storage facility, but it goes back to the same discussion we used to have when the wind parks first started getting developed. If we were to take all of that off of in fact, I just had this discussion over a campfire this weekend with my children because we were talking about the wind and the solar and I said, what would this county look like had those wind parks not come? Love them or hate them, but I'm just saying from a revenue standpoint, what would this county look like had those wind parks not come into the county? It's crazy. To me, it's mind blowing. It's like we'd be a fraction of the county that we are now, right? Mm-hmm. So that's what I've witnessed. That's what a lot of us have witnessed, right? Is we did see that increase. But right now, what's the next big increase? That's not, it's a decent chunk of money, but it's not wind park money. It's not like what we were getting, a handful of years ago.
Well,
so what is our next big increase going to come from?
Do you think, are you implying that data centers would patch the hole that was patched back in the 210 or 2, whatever it was, with wind energy? There's different multipliers now. We went through that fiasco.
Yeah, that's a whole other story. You tell me, I don't know what the next big thing's gonna be. That's why I said, how can you not just wanna just kind of be very conservative, be very careful?
So what advice would you have to the board in terms of from your projection, your crystal ball, this is first quarter. When does the rubber start hitting the road in your mind where you're actually starting to see what part of this year would you say, no, if whatever's coming, this is what I'm going to advise you? Where do you see that happening? Third quarter
I don't,
or tomorrow?
I think that I'm not sure. I don't, and I'm only looking at the revenue, the large source of revenue. I can't control all the other aspects of our county budget. But all along, knowing that this is one of the largest ones, just looking at this data, like I said, we have to all do our part to keep a close eye on what's going on. We don't have I don't see how we have a bunch of room for, extra spending. Unless, just knowing, like I said, I'm sure if we look at all the budgets, our expenditures are up, everything's getting more expensive. And our largest source of revenue our cup isn't exactly flowing over.
Chairman, the thing that we lack as a board is the old graph we used to have, which was with expense and revenue was projected out and we could see where it intersected. And we watched that a number of years ago, different board. Every meeting we just stare at that because it was a reminder of this is the wind energy issue.
Yeah.
Where the revenue is coming from. That has never been done since then that I'm aware of. But
She done it,
it needs to be done.
when you was doing
Sir?
Yeah, I was gonna say, I think,
she did a fantastic job at it.
just
Got a chart?
based on,
In fact, she got charts again today for us.
Then-
It's good to see some of the.
So whatever,
The questions that.
Lovely chart.
Patty.
So-
But she had a nice chart.
and what did the chart project in terms of when that line crossed?
We're not, well, one of the nice things, and I can let Connie, we're not using any fund balance this year, which we thought we were gonna have to. So that,
That's a carryover.
that's carryover, it's great, that 1.9 that we thought was gonna be deficit, no, it's not there.
650 off.
Yep, so we're doing good that way, we're not dipping into any fund balance, but we're projected to dip into some fund balance. But she's got some charts that she showed.
I'd like to see the charts because I've never seen them. I mean, you can email it to them or whatever. I never saw them. But I'd like to have it, I'll just ask you this question, Sharon. Was it projected out a number of years, like 5 years, or was it just 2025?
No, we only did through this year.
Well, you don't
So
have
far.
more telling us.
Well,
You've got to do a projection or,
Well, we will. I mean, this
Yeah, I
was
think
just,
we're working on
this was just the first step of bringing those charts back. And Connie
all right.
does realize that you like the charts and you will be seeing
No
those
further
more
questions.
often.
And it was again, but no, you have to, right, we did that, And once, of course, the audit's all done this year, so we know exactly where we're at this year. And you can start projecting up for 27, 28, 29,
well, going back to, like I said, that's why we're, having our meetings
Right.
and trying to, I think we can all do our part by just keeping close tabs on our own budgets and being, fiscally responsible, making sure that we know where we're at, right? And
Right.
like I said, be also looking at those projects down the road that we know aren't the normal and that we're gonna have to budget for, or what are the things that we stalled on or didn't do, this last budget cycle because we thought that we were in a world of hurt. That's the other thing that concerned me when we passed that budget was just, okay, what did we put off that still needs to be addressed? So, we could talk about this all morning, but
Tell you what.
no.
I'm encouraged that we're staying with rate of inflation. And
Yeah.
You put that project in over there 15 months. You add a couple of them a year, you stay with inflation,
Mhm.
you get up there, but that's,
Yeah.
at least we're at that, we're not falling.
Well, it just
Below
shows right
inflation.
now, like I said, barring any major economic developments, that's pretty much the figure that we're trying to guess because that's the figure that gets applied to our taxable and that's So again, we joke, even looking out 5 years, I remember going back to my home and he'd come down to our office, well, can you tell me what's going to happen in 5 years? I'm like, oh Lord, I wish, but it is still just, as a whole, you always go conservative, right? So we'd always, project low on the revenue side and, maybe go a little high on the expenditure side, just so that hopefully we come out somewhere in the middle. So I think that, this tells you, we just need to be very careful. I don't really have any rainbows or sunshine, but I don't yet have any doom and gloom, so. Any other questions on this riveting material?
No, it does us a lot. This last guy's gave me really tough.
Mhm.
Appreciate that.
Hey, you're welcome. Well, I'm just going to summarize and wrap it up with all local units came in this year at the statutorily required level of assessment, and there were no units that required factoring. The study has already had a preliminary inspection by the Property Services Division of the Michigan Department of Treasury, and the data is ready to proceed to state equalization, which occurs next month. So the 2026 Tuscola County Equalization Report is submitted for adoption and signatures. As always, our department wishes to express appreciation to all our local units, and especially our assessors for all their hard work and cooperation throughout the year. We do have a good group of assessors, so we're appreciative for that. And I'm appreciative of your time and your good conversation.
I was at Fremont Township this week, and they got a new assessor.
They are looking for a new assessor?
They got one because their assessor retired.
Yeah.
Yeah.
They did get one?
The guy from Marlette, he's hopefully level 4.
Oh, Nathan? Oh, so he does 3 units in our county already, and yeah, he's an excellent assessor. So, well, thank you for that breaking news.
Yep, he was at that meeting.
Okay, well, very good. And then Dayton is looking for one. And we just got a new one in the city of Vassar. So yeah, we got a few changes in the works, but I think so far all looks like good replacements. So
Good.
Yeah, be good. All right.
Thank you,
Angie.
Well, you're welcome.
Put that on for Thursday for motion.
Yeah, CA that for putting place on file.
Well, you have to sign, right? You have to
Oh, yeah,
submit
somebody
that?
needs to warm up either their stamp or their hand.
Yeah. You would prefer a motion? What have you done in the past?
I can look.
Okay,
CA, yes.
we'll CA it for now. Something changes.
Sounds good. Thank you.
Yep. You still up, sir?
Oh.
Was something I said?
I was just reading. All right, well, it's a long list on the finance technology. Next item today is number 2, mosquito abatement new vehicle purchase request by Larry Zapp, mosquito abatement director.
Good morning.
Well, Larry.
I just have a request for you this morning. We're in need of a couple new work trucks. I received 3 bids to purchase 2 new work trucks. Received a bid from Wassick Buick GMC in the amount of $72,100. I also received another bid from Pat Curtis Chevrolet for $70,740. And one other bid from McDonald Chevrolet in Millington, Michigan for $68,677. So this morning I would like to request to purchase 2 new work trucks from McDonald Chevrolet in Millington in the amount of $68,677. These 2 new work trucks would simply be replacing 2 of our 2010 models which have reached their mechanical limits. And this purchase was anticipated for and planned for in our 2026 mosquito abatement budget. And that's all I have for you regarding that, unless you have any questions for me. And again, that was for 2 trucks. We'll be replacing 2 of them. We've been taking our older trucks that we've been phasing out to Albrecht's auction. Put them out there for the public, and it seemed to be working out well. So those two, if approved, those two older models will be going to Albrecht's for the public to bid on, so.
And it's budgeted.
Yes, sir. Yep, we are budgeted for that.
I'm good with that.
Put it on for a motion.
Motion? Motion on that.
Okay.
Thanks, Larry.
Thank you very much.
Larry.
All right, Michigan Association of Counties Finance and General Government Committee report. What I started on earlier, you can see the discussion on revitalization. It really was, that is more than a Cliff Notes version, what was written in terms of the discussion. Obviously, what's happening is that looking in the future, they're looking at consolidating regions, an attempt to save money, and that includes boards and other factors within local governments. So long way off, but the discussion made it into MAC. The other thing I just wanted to mention, there's several items there. Obviously, the prosecutor funding. A lot of these have been ongoing. It was just a short update. EMS funding, but the one that the Rural Health Transformation funding is an interesting one, only in the sense that what didn't get said here was a side note, but basically it related to, as you're very much aware, many of our hospitals have affiliated with someone. We're getting consolidations. In where we used to have rural access hospitals, now we have several hospitals joining together. And this is part of the funding. Now that sounds like a good idea because obviously years ago they tried to do away with rural health because they didn't believe they had the talent or technique to heal people. And that was a battle back then. In the sense that that's over now, and now obviously the consolidation. Now what it does bring you is the fact that as you consolidate, the number of potential competitors billing are getting reduced. And as this occurs, obviously, as they get larger, your Blue Cross billings, what's allowable is going to be probably changed. Because obviously you can submit a $1,000 bill if you get $300, you're doing well. I just made that up, but I'm sure it's changed since I was in hospital administration. But just keep that in the back of your mind as you see the consolidations. Yes, there are some great advantages, but on the other side, when it comes to the payments, like I don't want to use the word monopoly, but as things narrow down, there's more advantage to negotiating rates. And if there are any questions on that, that was the last, and we have a MAC meeting today at 2. Item number 4, discussion of potential non-union wage increase. Mike Miller, interim administrator.
Yes, commissioners. What I would like to do is have Connie give her presentation first on where she sees we're at in the budget as of right now.
Good morning.
Morning, Connie.
Yep. Okay, so this is right now, basically right where we're at as of today, or as of what, last week? Last week when I put this in, this is where we're at. We're unaudited. We're doing pretty good. We're doing pretty good when it's for 2025. This shows that the figures for, and comparing from 25 and 26. 26 is the balanced budget. Sorry. And this shows, we're looking at projected financial position right now. We're in our position, we're still using fund balance. This is the original. This is the original when we presented it a while ago. And
Well,
then,
just back up, just so they understand the use, what the 137 is for 26.
Yes, this is for 26. This is not,
As the original budget stated.
yes,
Use
this
of
is
100.
not, yeah, this is not 25, this is the original budget. And this includes our starting point, preliminary, our starting point
So
for
after,
fund.
at the end of this year, we'll have 137,687 added to the fund balance.
On paper.
On paper, this is just strictly projection. It's not final for 26. This is our starting point for our fund balance, our starting point changed.
So 25, you're going to finish better than what you
Yes.
thought. What do you expect? But the budget, when you passed the budget for 26, you budgeted the balance, you were going to use 137,000 fund balance. That's what she's trying to explain. Is that this is
Yeah.
where 26 is started.
Yes.
So all the rumors out there that we're 1.9 in debt,
No.
we're not.
No.
We're at the 137.76 projected.
On paper. going-
On paper,
yes.
okay.
This is just the
Well,
projection.
Wait a minute, Chairman. The 1.9 million, you used the word debt. It wasn't a debt. As I understand, the 1.9 million was pulled from the departments while budgeting the 26 budget to shore up what was a shortfall.
No, the 1.9 million was of everything. If everything that was requested by the departments was approved by the board, you would have had a 1.9 million shortfall. That's
Well,
everything.
that's sort of an interesting turnaround of what's been presented all this time, and I sat to meetings across the street all day. So if they would have gotten everything they wanted, so you basically took 1.9 million of the request and put it to zero.
Well, I think you still went into, you were projecting to use 650,000, correct? Of
For
fund balance
25.
in
For
25.
Okay,
Yeah.
I'm in the
And that-
26. We're separating.
Yeah, that's what I meant.
I'm in 26.
25.
They brought it back down to 650
Right.
instead
But-
of
I'll
49.
go with
Right
that.
now, after all the money's coming in, to find out that they didn't have to use that 650,000
Right.
either.
That was the max.
Yeah, that.
Yeah,
Okay.
that was
I'm
That was
the
for-
max.
Yeah.
We brought it
2025.
down at 650, and now for the revenue and everything has gone out, we're finding out that we're still in a little better shape.
Yeah, we're in better shape for 25. Preliminary, we don't have the final numbers yet because we're still in the audit. We're still in the audit, so we still need our final numbers after.
But barring anything that nobody sees coming from the audit, we should be, what, 100,000
Yeah,
plus?
Yeah, 100 plus, so
Instead of
far.
using 650 fund balance, you're going to be to the good of 100,000.
Yes,
So we used 500 and some.
no.
No, we won't use it.
We
No,
won't
won't
use
use any.
any.
You won't
Right
use
now,
any.
we're in the good, right this minute,
So the 137 represents,
for 26.
okay. moving on.
That's projected for 26 to make it balance. Because there was a shortfall on revenue.
Okay, so in 26, you're estimating that we will use $137,000.
Yes, for 26.
But we really don't know until we do, because we haven't budgeted 26 yet.
Yeah, you
Oh, yeah,
passed.
Yeah, we passed the
we're in
budget.
26 now.
We
We're in
passed the
26
budget.
now.
But this is the only estimate. I mean, we can't
Right.
determine what's the outcome yet, but this is the only estimate that we came up with to make it balance. Because we had a shortfall of revenue, what we projected. So, how we proceed?
All right, I
So
guess I'm
we all
trying to
understand.
follow this. We had a shortfall in 26 of 137 some
For
thousand
projected,
that was projected, and it was projected when the budget was made.
yes,
But how did it get balanced? What did you use to balance that budget then?
the 137.
Okay,
Of
which
fund
is out of the
balance.
fund balance,
Mhm,
right?
mhm.
Which was 650 or so at the time, or
And 25.
And
in
25.
25, but you had to carry it forward. Whatever was left in balance in the 25, you moved over to 26.
Mhm. That's,
At a
if
tune
you
of
notice, the
137.
total budget changed from the original.
Mhm.
Because the original was 5 million. The very bottom, that's 6,498. That's including the the adding to the fund balance from 25 so far. This is preliminary.
So at the end of 26, though, we're gonna add to the fund balance.
Yes, we're gonna add to
So
the
we're not
fund
using that
balance.
137,000.
We're gonna add it from 25 so far. But,
That's the contribution.
right, that's the contribution so far. But in reality, we had to balance the budget, so we were shortfall revenue. So we had to use the fund balance for projection.
So that's on paper, but in reality, first quarter, we don't know what departments overspent, underspent, and how they came out.
And not all the revenue has come in either. So if I give you a projection, it's gonna be, the expenses are gonna be super high because not all the revenues came in.
Well,
We've got revenue sharing coming in, we've got some revenue
So
that,
the projection you give us, you know it's coming in.
yeah,
What's
it's
that?
coming in, but we need to, if I give you a first quarter, you're gonna look at it like, why are expenses so high? Well, not all our revenue came in because the revenue sharing hasn't come in, our revenue hasn't come in.
Well, Chairman, the way it used to be shown, I don't know, was that fact that we would have a projection, but yes, revenue would be lagging, but it would show estimated revenue against current expenses as a projection of, at the
Right.
highest level of work. Are we tracking, or does it look like it's getting over? Because that would give us a signal to put the brakes on or say, okay.
Commissioner Bardwell, you were absent at the last one. The county did just give a brief update. And it is our intention going forward that county will be here at least once a month to update you where we're at currently, what she's going to do today. We're sitting where you're at today.
I didn't
And
ask
going-
for it now, I just make it a
Well,
statement.
No, and I
I
just want you to
wanted-
understand that that is our intention.
I understand that, that was understood before you
Okay.
became administrator, we had county at least once.
We got, we've had requests, Commissioner, for non-union wages, so that's why I asked Connie.
Yeah, let's go to that.
I asked Connie to come in here.
I like
Give
his
us some-
thinking.
give us-
Y'all
give
make
us
some
some
sense there.
clarity.
Let's go to that, Trevor.
I want Connie to let us know where we're at
Yes,
on that request.
yes. So the
Okay.
requesting, so right now, we've already had negotiations, so right now, here is our projected unaudited, right now for 25. And then this is where we're gonna be with the non-union and the non-union 1% and with the union right now. Because Mike and I worked on it,
That's on the right or on the left?
on the right.
On the right, yeah.
So just to sum this up in my mind, request is a 1% non-union pay raise,
Yes,
and you're
Well-
showing the
Well,
effect.
it's not a request.
Legal
We're just-
says we want to talk about
Yeah, we're just showing you what a 1% will look like.
I see.
it.
If you want to flip to the next one.
this is what we would use, this is 240,000 so far in fund balance.
So
This
that-
is projected on paper. We don't know what the outcome is going to be in final. Because we already saw 25, we didn't expect to have more fund balance added. We projected 600 and some $1,000, use the fund balance, and we come out to the good for 25. So if we pay attention and look closely at our budgets, and our department heads look closely at their budgets, more closely now, to keep it this trend.
So a 1%, if you were to start at May 1st or
Oh, yeah,
beginning of May through the end of this year,
it would
would be about $27,000 for the non-union general
Yes.
fund. So that is what this number is representing, what county sees. Now, again, that number is if everybody spent their entire budget.
Right.
That's where you would end up.
And Chairman, the 26 budget had 0 non-union pay increase? Is that how we saw that?
Chairman, question. So explain to me. So if, let's hypothetically, given the 1%, we're gonna take 240,000 out of the budget of the fund balance
For 26.
for 26.
Yes, for 26. But that's on paper, that's,
Okay, I just,
if,
yeah,
if all goes well, like 25, We shouldn't have to, but
And
you can't determine that yet.
Commissioner, that 240 represents all the union
Yes,
raises.
actually,
Oh,
yes.
That's not
all.
just general fund. We
Okay.
factored in all the approved raises
Yes.
to the, or wage increases to the union.
And that's
Yes.
including the 1% if that went that way?
Yes.
That is 1% general fund,
Okay,
Yes.
got it.
Which
All
is
right.
27,000,
which is 27,000 if you did half the year.
which was
Yes.
added to the union, which has already been decided and.
Right.
So that does include everything.
I was confused, sorry.
Okay, what does this mean, Chairman?
So I guess we talked about the non-unions, if the board wants the non-unions raise 1%, 2%, or whatever. We have talked about the non-unions, but we do have some non-union people that have requested that we put it on the agenda, so at least they want to hear a discussion. It's coming down their way. The most we can do is 2%. You go above that, then the unions have to be 2 calls, then they get more. So, that's if we give 1%, that's where we're at. So what's the board want to do forward? This does not include the county board, because we made a motion to exclude the county board for the raises. So this does not include us.
So just to go back, I think I heard what you said. If it was 2%,
It'd be
there's a
double.
Me Too agreement.
So if it went over 2%.
Over 2%.
Right. And whatever I think that we decide we ought to do from, like they said, May 1st moving forward, I don't think we ought to go retroactive, because that's more, it's so much more work on that office under the
Yeah.
retroactive. It's crazy what they have to do.
You know, looking at this from, I'm still not clear on budgeting, projections, where we're
And
going
we
to
can do
end up.
nothing, too, Commissioner.
All right, setting it all aside. It would be difficult with what's been said up to this point to deny a 1% to the non-union. They would be the only ones who would not get anything. Compare that to inflation, which, I don't know if Andrew said what the inflation rate was 3%, something.
2.78.
2.7. They've stepped backwards. And what you just said is there been some concern request to bring to the board a 1% for the non-union, right? Or was it an open, you just used 1%?
Just use 1%. Yeah.
I see. But again, I'm going back to that. It just seems if those who know finance better than I do at the moment see 27,000 from May to December. Of course, this has a legacy to it. Wouldn't it be considered, I mean, we either are in a budget crisis or not, but if we're not, we need to recognize our employees that we have in terms of the non-union, because the union represented the non-union. I mean, the union represented the union employees and came out with something. Is that not true? I don't think I'm getting any resistance here. I'm just walking through mentally. I'm not sure of the opposition to this. What is the opposition? I could give opposition, but what's the opposition to 1%? Just think on it.
Yeah.
Chairman, so if it did do that, what would that do to the budget as far as the 240,000? Hypothetically, where would we land at? As far as how much would be in the bank?
Be in the bank?
Well, you're gonna take this out of the general fund balance.
Yes, general fund balance.
Okay,
yes.
so where would we be if we did that 240,000?
Okay, so you see all the way to the right, preliminary ending fund balance? That's where we would be at.
You'd be in the red 240,000.
No.
Are you asking if you spent the 240, where would it come from?
I know it would come from the general fund.
Okay.
Fund
Where would
balance.
our general fund be?
It'd be,
That-
expect,
I think that's the 6.2 million over, all the way over.
All the way to
there
the
that
right.
she's Referring
Okay.
to.
Isn't the 240 the well, it's the union wages and.
Yeah,
It's with the
With-
union
with
wages.
All the
1%.
contracts that we just
Yeah.
did.
Yeah.
Yes,
Yeah.
the
that's everything.
that's everything.
Yeah.
Anything else?
Anything else from Connie? Or-
For me, can we put together something, a good explanation that not only I could understand, but people in our network can understand on that budgeting with that 1.9? How we came with that, from that deficit to balance our budget? Because I'm
Yeah.
understanding a little bit different here today than what I understood before.
Well, when the first request came in from all the departments, everything they wanted,
Right,
if we honored everything they wanted at that point with what we're seeing, we'd be in deficit of 1.9 million, okay?
right.
But then when they came back with the request that they ended up with, it took that from 1.9 down to 650,000 because there wasn't near as much as they wanted. They came back, okay? But through the course of the year, there's been more revenue come in than was expected. That's why we're ending up with a fund balance instead of a deficit at all.
Was it the 26 or the 25?
It's 25,
Yeah,
For
25.
25.
right, 25.
This
Now we're
is
moving-
preliminary, it's
now we're
not
moving-
audited
right.
yet.
Now we're moving to 26 with a little bit of that, with all the
There's a
stuff. that-
carryover.
There's a carryover with all the stuff that we approved. And if we gave the 1%, we'd be looking at using $240,000 in the fund
Because
balance.
we've taken up a big beating about,
Well, because,
our deficit.
because we did follow through all the way through the steps. Because at first, they remember that one projection of 1.9. The public remembered that forever.
Right,
They never listened to anything else we were saying as we were going through the steps. They just kept, that's all they heard, but that's what they just ran with. And I wanted to correct people over there last week a few times, but I didn't. But anyway,
Well, Chairman, the fact that I was the precursor to that was Clayette's projection, that 3-year projection they projected, which we still have, we want to look at, the loss, which everybody saw that November. And in 26 as well, and in 27, if I recall. There was the beginning of other than the 1.9. I mean, there's a lot of confusion related interpretation. But circling back to this 1%, I'll defer back to you because I said what I was thinking in terms of the impact of employee morale. Something.
so what's the board thinking about? 1%? 2%?
I'd go along with 1%.
I'd go with the 1%. I mean, it's,
From May 1st moving forward?
Yeah, that makes too much of a headache in that office in there if they have to go back. It's-
Finance here?
I
refer back to you.
move back between 25, 26, and wonder about 27 because that's going to come up. Usually we start working on that in August or July, in past years. But I would suggest that we move this to Thursday for further discussion, and if there's going to be any action, we'll take it Thursday.
I'm good with that.
Yeah, I'm good with that.
Okay, we'll move to Thursday, Mike, put on Thursday's agenda for further discussion, give people to think about it a little bit.
Maybe a little more finance thought on it, and after I get those financials as you're talking about. I get a copy of those, email, whatever. All right, that concluded number 4. Is there any other ongoing, other finance? Hearing or seeing none? How about ongoing other technology, GIS?
Nothing at this time.
All right, thank you for that. Moving on to building and grounds, turn it back to you, Chairman.
I'll turn it over to Commissioner Lutz.
Mike, do you want me to take this or you want to do it?
I can take it if you like.
Okay.
We have a request from the Carroll Parks and Recreation. They'd like to use the courthouse lawn on July 8th at 5:30 PM until 7:30 PM. There is a nationwide public reading of the Declaration of Independence, and they'd like to take part in that and use the courthouse lawn for that purpose.
CA?
Yep.
Yeah, CA.
Thank you.
And the dispatch tower inspection, Carrie Tabar, interim dispatch director.
Good morning. We need to have the tower inspected, the dispatch tower. I made contact with Great Lakes Tower and they provided a quote of $2,600. And then as soon as it's approved, I can call them and they think that they could get us in fairly quickly depending on the weather.
Carrie, do you know what does that inspection entail
It's going to
generally?
be, the inspection is to do plumb intention,
Make sure it's straight.
right? And then any adjustments after that, that would be an extra. He gave me just a ballpark on that. He said 3,000 to 6,000 for that if there's any issues, but that's not anything in writing. That was just a verbal.
So if this won't fix anything, that's
Correct.
just to see if it needs anything.
Just to see how we're doing.
And Mike, does that come out of their budget?
It would, yes.
Chairman, is that something we do yearly or is that something that just random?
I can't find any records that we've done it.
How did they get initiated then? I mean,
I
why?
believe we used to.
Oh.
And I believe that my research just found, and with Steve, I understand that we should be doing it yearly and then after any significant wind event. So this will at least get us caught up and then we can get advice from the tower company on where to move forward from here.
No further questions.
CA?
Yeah, I see it.
Thank you.
Thank you.
Mike, any more ongoing buildings, grounds?
I can just touch real quickly on the tunnel inspection that did
Oh, yeah.
happen. They're gonna write a report, but the preliminary is the tunnel looks great. I can't believe how good it looks actually. But they don't see any issues with it. There's just some surface marks that have popped out over the years. They could patch whatever, but it's underground. Nobody's gonna see it. They just use it for basically inmate transport and as a severe weather shelter. But they really thought it looks good because the jail work site crew paints it every other year. So they said it was in good shape. They didn't feel that there'd be any issues and they'll write a report and send it to us.
That's all I have, Chairman.
Okay, move on to personnel. I'll send it over there to Mr. Burials.
Yeah, and we'll have Larry speak to the new hire.
Just a request for you this morning, Commissioners, to hire Connie Blacker. Connie would be replacing another field technician, Jessica Dopp, who moved into the vacant utility person position. Connie would begin work on April 27th at a starting pay rate of $14.85 an hour, pending a background check and a physical. And that's all I have for you on that.
CA?
Yeah.
Yep.
Okay.
Thank you, Commissioners.
See you later. Any other business is necessary? One thing I have, it's always clear over here. Area 7th, a while back, we appointed somebody in Henry Wymore's position. Brown, I think.
Area aging.
Yeah, aging. And evidently, they haven't been notified, the person we appointed hasn't been notified. And they brought to my attention that to make sure that Because we'll find them on the appointment.
Okay,
The area 780.
okay, they should have received that, but I will double check on
Yeah,
that.
double check on that.
Yeah.
Just according to them, they haven't received it, so I said I will check it.
Yeah, absolutely.
Okay, any public comment?
My name's Ian Lee. I'm the Chief Information Officer for Tuscola County. I'm speaking to you today as an employee of the county. I wanted to talk about the fictitious 2.7% inflation increase that was referenced in this meeting today, that everybody in this room would agree with me that gas, electric, and food is extremely more expensive than 2.7%. Not only that, the non-union employees of this year were handed increased medical costs. The morale of this county's employees is quite low. So I'm posing this to you. Is 1% fair for a non-union employee to receive an additional compensation, especially if it's non-retroactive? Please consider that before your discussion on Thursday. Thank you.
Thank you. Anybody else? Anybody else? Let's discuss more. Do you see anything else out there? Let the record show that public comment was offered, and we had one participant, Ian Lee. And with that, I'll take a motion to adjourn.
I'll make that motion.
Support.
The move by Mr. Cook, supported by Mr. Barrios to adjourn. The committee of the whole meeting this morning. Any more discussion? All in favor, say aye.
Aye.
We are adjourned.